Hey, future nurses, are you stressed about getting your license? Here at Remar Review, we believe in faith over fear. I'm Regina Callion, the #1 NCLEX instructor in the world. Tune in to Remar Nurse Radio on Spotify and Apple Podcasts for new episodes every Thursday. We got that exclusive content. You don't want to miss it. We can, we will, we must pass NCLEX. Welcome to the 7 Days of NCLEX. My name is Regina, MSN RN, and I've dedicated the last 10 years of my life to helping students overcome anxiety, pass NCLEX, and get their nursing license. There is a way to study for NCLEX by focusing on the content, and I'm going to show you how it's done. Go ahead and get out your downloadable workbook so we can take notes. All of the information today is coming from our NCLEX virtual trainer. That's right, you're going to see this amazing program and how beneficial it is to help you get your nursing license. The NCLEX virtual trainer, this is the best resource I've ever created for nursing students to pass their exam. All of the Remar nurses are in it right now. They're loving it, and I want you to have it too. We cut the price to just $150, so you didn't have any excuse why you couldn't get this amazing resource. 2020 is coming up. I want you to have your license. I created this amazing product so you can take control of your learning experience. Let's make NCLEX preparation easy. Get the virtual trainer. We have it while supplies last. It's just $150. I'm so excited for you to get your license this year. Oh, it's going to be an exciting class. Let's get started right away. If you have your downloadable workbook, we're getting started with day 1. So make sure you have your workbook. You're going to need it to take these awesome notes. We're going to do an NCLEX overview. I'm telling you, the information that you need to pass NCLEX. There is a secret to passing this test. I'm going to tell you what I think you need to do in order to make your studying life so much easier. Let's look at the first topic here. My NCLEX point #1. You need to write down the details of the exam. In order for you to feel comfortable with this exam, you got to know the intricate details about the test that you're going to receive. You've never taken a test like this before. You haven't. So going in knowing how the test is structured, going in knowing the maximum number of questions you can get, how long it takes most students to pass is going to be very helpful for you in helping you to reduce the anxiety, reducing your anxiety. So check it out. For the NCLEX PN, these are the latest statistics, and you can write this down in point #1 if you're an NCLEX PN taker. If you're an RN taker, just hold tight for a second. I'm going to go over your numbers too. But in the exam, did you know that there's some questions that don't even count? There's some questions that won't even matter if you get them right or wrong. They're called pre-test questions. Pre-test questions. And on the NCLEX PN, there is actually 25 of them that you will take. Now, let me just say this. Your pre-test questions are not the first 25. They're not the last 25. They're literally mixed into your exam. And what they're doing is they're wanting you to do research. So the pre-test questions, these questions are used for research. They're used to see whether you've been exposed to the information or not. So the pre-test questions for the NCLEX PN, there's 25 of them. Now, the minimum number of question items you will see is 85. So that means you can pass NCLEX with 85 questions, or you can fail it if you are a practical nurse. The maximum number of questions that you will be exposed to is 205. And this is really cool because when you go in there to take your exam, I need for you to be prepared to take all 205 questions. Do not go in there hoping that you will only get the 85. Be prepared for the 205. The time that you get to take the exam is 5 hours, and it takes about 2 hours and 30 minutes for most nursing students to complete this exam. So it is a marathon. It is a very serious test, but you do and you can and you will have all that you need if you're studying with Remar Review in order to pass it. All right. Now let's look at the RN statistical facts. There's only 15 pre-test items on this exam. So when you go in, understand, hey, and this is my mindset, and I've said it to you guys before, you get a question that you don't know the answer to and it's just totally foreign to you. Have the mindset, you know what, that didn't even count. Just say to yourself, that was a pre-test question, and you'll feel so much better. You'll feel so much better for the next question that's coming up. Remember, you have to reset every question, because they're going to be coming from so many different topics. I know my repeat test takers out there, you can attest that what I'm saying is true. The questions come from all different categories of the test plan. So literally you have to reset when you get your next question. Oh, I love 7 days of NCLEX. We really get into the exam. The time that you get in order to take the exam is 6 hours, all right? And the average time for nursing students to complete the NCLEX RN is going to be 2 hours and 40 minutes, okay? So just write down your facts. Whether you're a PN or RN, go into the exam knowing the skeletal structure of it. Now, I want to look at the second NCLEX overview point, which is this. For you guys that know me, when you see this point, you're going to say, yes, this is the motto of Remar. And the NCLEX overview point is simply this. You need to start the process of preparing for NCLEX with content first and not questions. And I'm not going to spend a long time on this point, but there is a myth out there that in order to prepare for NCLEX, you need to do questions first. And I remember getting an email from a nursing student, and she literally said, Regina, I am so tired of memorizing rationales, question rationales. I can't do it. And I am encouraging you guys during the 7 days of NCLEX, really look at the process of studying the exam. Because when it comes to NCLEX, I've identified a huge weakness. I think the NCBSN, they have also identified a huge weakness in the exam. Do you know what that weakness is? The weakness is this exam is too sterile. This exam is not like the real life of a nurse. And so, because it's not like the real life of a nurse, all of the correct answers come from where? Where do the correct answers come from? The correct answers come from our nursing books. And so, if you want to do well on this test, you need to know the book information. And it's not a matter of how many questions you studied a day. It's more so a matter of how much of the content have you mastered. And so during the 7 days of NCLEX, I've taken pages from the virtual trainer and put it into your workbook, okay? So when you will open up your workbook, you'll see, hey, this is content. This is a lot of content here, and that's what we need to have in order to pass our NCLEX exam. You need to have that content. You need to have the information in order to make the questions more palatable for the anxious nursing student, all right? It's not a matter of you not being anxious. You're gonna have some anxiety, but if you've studied the content, oh, you're gonna feel so much better. You're gonna feel so much better. All right, let's check out the next point, which is this. Let me give you an example of a content-based question, right? Identify the positive symptoms of schizophrenia. Identify the positive symptoms of schizophrenia. And this is a select all that apply question. So you guys know with select all that apply questions, they are totally about the content. Here are the choices. Number 1, suicidal actions. 2, delusions. 3, poverty of speech. 4, apathy. 5, neologisms. Put your answers on the screen. Put your answers on the screen if you know the correct answer. Also, share this video right now. If this is going to be helpful to any of your nursing student friends, let them know 7 days of NCLEX Day 1 is happening right now. We're talking about how content really helps you get through the NCLEX exam. Now, if you have not studied the content and you get a question like this, it sends you into panic mode. If you haven't studied schizophrenia and you don't know what it is, how can you identify the positive symptoms? And so when we're looking for questions to prepare us and not content, in our minds, we're searching through like, oh, did I ever get a question on schizophrenia? Did I ever see one in my question bank? So you're hoping that you have at least done a question, but if you know the content, then you're going to know that the correct answer for the positive symptoms of schizophrenia are going to be delusions and neologisms. Oh yes, delusions and neologisms. And so not to go too deep into this answer choice, but I'm going to take you guys into the virtual trainer during the 7 days, and we're going to do this psych review. So you're going to know positive symptoms of schizophrenia. You're going to know what I'm talking about here if you haven't been studying with Remar. All right. So content before questions, you got to know it. Suicidal ideations is a negative form of schizophrenia, right? Poverty of speech, when you take away the speech, that is a negative symptom. All right. Apathy, also negative. So you guys are able to determine that content is what really supports you through this process. Now, let's look at the point number 3, and it's simply this. Remember, nurses, when I'm talking about the content is always the minimum competency for entry-level nurses. So it's not an exam for a nurse who has been practicing for 10 years. Traditionally, nurses with experience, they don't do well on the NCLEX exam. They just don't, because it's too different from what really happens in practice. So if you're a repeat test taker or you're an LPN transitioning to RN, you might find it a little challenging to get through this exam. But the very best students are the ones who have no experience. So I'm encouraging you guys to understand that what you're being tested on literally is how do you keep a patient alive? Like, that's the minimum competency. If I had to put it in my own words, is how do you protect your patients from a sudden death? Okay, so here, let me give you this example of what that looks like. So here we have this question, right? And it simply says, the nurse enters the room of a client who is scheduled for a right total hip replacement in 2.5 hours. All right. Now, on this screen, you have some highlighted option fields. I'm simply asking you guys, out of everything that you see that is highlighted, which are the inappropriate items to be in that room? Okay, this is minimum competency, guys. Okay, and check this out. I got this photo when I went to the NCLEX conference, and they were talking about how to prepare the next generation of nursing students. So I'm presenting this to you guys, and I literally want you to look at the picture and type, what is the issue with this picture? You have a client that's going for a what? A right total hip replacement. So now, if we have a client prepared for surgery and I'm looking at the items on the screen, I'm just going to look at the IV bag. There's an IV bag with some solution in it. Am I concerned about that for a pre-surgical patient? Am I? No, I'm not really concerned about it, because I know that the IV fluids can help the patient with what? Write it down. Everybody should be saying we give IV fluids for dehydration, right? So there's no problem with that. Let's look at the rest of the picture. We have, it looks like some water, and it looks like a meal tray, maybe some eggs, I don't know, a little spinach. Do I have a problem with that? Do I have a problem with the clear liquids and the meal for my patient who's going to get a hip replacement in 2.5 hours? Yes, I absolutely do, because my pre-surgical patient needs to be what? Yes, they need to be in PO. Shout out to all the Remar nurses right now. You guys know exactly what's happening here. The patient needs to be in PO. So I can see in the background that there is a monitor checking the patient's vital signs. I'm okay with that. I mean, that blood pressure, I can't really make it out. It seems like it could be low here. So I might have an issue with that, but I don't know. I can't say. That could be pulse, and then that could be the O2 saturation. But the main concern is definitely that meal tray and those liquids. And so when I talk about the minimum level of competency, this is not a critical analysis question. This is simply, do you know as a nurse before a surgery that patients should not eat? All right. Now, what makes these questions so difficult is the presentation. It's the presentation, because you can get select all that apply, or you can get, just basic fill in the blanks or hot spots or audios. And so nursing students are really, I want to say, terrified of the exam, but I'm telling you guys, the content is simple. The presentation is tricky, but the content is simple. And you must pass NCLEX. Point number 4. It's good to be able to identify the various cognitive levels. And when I'm saying this, I don't want to be too technical. It can sound very fancy, but essentially the exam questions are based off of certain categories. All right. And this is the Bloom's taxonomy chart. You guys don't have to know this by any means, but I just want you to understand that there are going to be some questions that really just test whether you can comprehend, whether you can remember, right? There's going to be some questions where you actually have to apply what you learn. You actually have to be able to analyze a situation. So I just showed you a picture where you had to analyze the information and then make an evaluation. So the exam is getting more aggressive in the higher levels of your knowledge. And that's true. The difficulty of the exam is at a point where 20, 30 years ago, the nurses back then were not getting the same types of questioning you guys are getting. But remember, the patients now are sicker. The patients now are living longer. They have more medication options. So it is important for us to be able to understand the different levels of questions. So I like to present my questions to you guys at the application and analysis level, because those are where the content really is tested. All right. And then I do have evaluating and creating, but for most nursing students, especially those who've been out of school for quite some time, knowing if you can apply the information and analyze it is going to be the strongest foundation for you all. So this is just kind of what is happening when you apply the information, and a lot of nursing students get this on their NCLEX exam. It is essentially, can you use the information that you've learned in new situations? And you guys know I love putting you in new situations, looking at your application levels, analyzing the information. Are you able to draw connections from general ideas? Okay, so that picture was an example. Can you analyze the picture to make a connection that, hey, pre-surgical patients don't have meal trays? There's something wrong with that. And so that's what the kind of question will look like. And when you're going through your exam, understand that these are not new concepts that only you are being tested on. Nursing students from all over are doing these same steps. And because they are passing NCLEX, you will also be passing NCLEX. So evaluation, when I talk about the evaluation category, It is essentially, are you able to determine, are you able to justify a decision that was made? So I have the example here. If a doctor writes an order, is it appropriate? Is it going to be valid for you to administer? Because at the end of the day, your license is on the line. You are the final stop for that patient. We're talking about evaluation here. And then creation. As a nurse in your own situations, are you able to anticipate what a medication will be prescribed for? Are you able to anticipate a treatment plan? So these are the higher level questions that a registered nurse and or a practical nurse are going to have to be able to answer when they're taking this exam. This is day 1 of 7 days of NCLEX. We're talking about the overview of the test. And remember, guys, knowledge is power. Knowledge is power when it comes to this exam. The more you know, the more confident you are, the better you will do. All right, my point number 5, I'm going to go to it. Remember the integrated processes. Oh my goodness. I'm telling you what, from the students that I have dealt with this year who have not passed their NCLEX exam, integrated processes have been, I think, the most challenging. And it's really because they are the forgotten concepts that we don't study for. And we think of integrated processes, it literally can be anything. I'm serious. People can put any kind of information in integrated processes, but it's a general type of performance that nurses do. So let me give you this. Okay. Integrated processes. For example, the nursing process. How many questions can be written about just our nursing process? So many. You can turn any type of subject into a nursing process question. Also, caring. What does that look like? What is communication and documentation? What is appropriate, right, for the nurse? Cultural awareness for all the different religions, for all the different beliefs. Self-care, the education for diseases, the education for mental illnesses, the education, right? And then teaching and learning examples, These all encompass integrated processes, but very rarely do you see an NCLEX resource called Integrated Processes Review. Like, you don't see it, right? And very rarely do you see questions that say self-care questions or cultural awareness questions. And so these are the forgotten concepts when it comes to NCLEX, and these are the ones that I really tried to focus on in the virtual trainer, as well as all the new questions that you see Remar putting out, because this integrated processes will be so difficult if you have not studied the information. All right, so I wanted to make you aware of these 5 points and carry these 5 points that we learned in the beginning throughout this entire 7-episode review, because they're going to be really beneficial for you to keep coming back to. Now, there's a practice exam, and I want to go over the practice exam because what it's going to do is going to give us a baseline for where we're at. And don't worry, you are here to learn. Another thing with learning, just so you know, because I don't want you to be too hard on yourself, Remar nurses, we love to get everything perfect, right? Yes, we love to get everything perfect. We love to get every answer right. But now is actually the right time for you to get these questions what? For you to get these questions wrong. I want you to get all of these questions wrong if you need to, because then you will know the right answers when it's time to take the test. Everything we're doing right now is for you to be able to one day take your test. So let's do the practice exam. Let's see the first question. All right. And these come from the NCLEX virtual trainer. So enjoy. First question says simply this. Here we go. A nurse is caring for a client with comfort measures only. Okay, they have comfort measures only order from the healthcare provider. Which of the following should be on the interdisciplinary team. Select all that apply. Select all that apply. All right, so we see the client, we know their situation, comfort measures only. Who do we want on their interdisciplinary team? Is it number 1, the registered nurse, 2, pharmacist, 3, the dietitian, 4, healthcare provider, 5, chaplain, 6, respiratory therapist? And remember, with select all that applies, it can be one question, it could be one item choice, or it could be all of the item choices. So here we go. What do you guys think? Go ahead, be brave, share your answers. This is the largest nursing study session on the planet right now, hands down. Congratulations, Remar nurses. This is how we do it. The correct answer is, the registered nurse. Got to have a registered nurse for this patient. The healthcare provider and the chaplain. The healthcare provider and the chaplain. And I know a lot of you guys, you picked pharmacist. You want to have a pharmacist. You want to have a dietitian. You want to have a respiratory therapist. But when you get these interdisciplinary questions on your NCLEX exam, you have to know, what is the purpose of the interdisciplinary team? What is the function? The interdisciplinary team is not just something that his client gets because it sounds good. No, there's a function. Everybody on the team has a purpose that helps to move the client in a certain direction. So let me show you guys this. When I'm talking about the goal of the interdisciplinary team, the goal of that team is to reduce client harm, okay? It's to reduce treatment errors, and it is to coordinate the overall care, okay? So what is the function? Let's go back to the question. We have a patient that essentially is dying, all right? The patient is essentially dying. So what really will be put in place? You'll need a registered nurse because the client will have some comfort measure only medications that have to be administered. And it's going to be the nurse that's going to do that. The pharmacist. Do we need a pharmacist on this case? No, they're not necessary. Clients with comfort measures only, they're not being prescribed tons of medications. There's not going to be any issues of polypharmacy or allergic reactions or stronger new antibiotics that will need to be reviewed, okay? The dietitian. Are we going to have a dietitian consulting this patient for healthy food options? No, because clients who have comfort measures only, they eat as they're tolerated. They eat essentially as much or as little as they can. Normally, if clients are going through the dying process, they're not huge eaters. They don't have an increased appetite. So you wouldn't need the expertise of a dietitian coming in, sitting with the patient, evaluating the patient, and then implementing a diet. And so I want you guys to think about actually the condition of the patient and the function of the interdisciplinary team when you're doing these questions, because you can get a lot of them like this. All right. For a client who has comfort measures only, the client is dying, do we need the healthcare provider? Absolutely. Because even through a comfort measures only, there has to be a director of the medical care received, and that's going to be the healthcare provider or the physician, okay? The chaplain in this case is appropriate. There may not always be a chaplain involved in the interdisciplinary team. If you have a medical surgical patient, with acute renal failure, are you going to have a chaplain automatically on the team? Not necessarily, right? Chaplains usually don't see patients with acute issues, but this patient is comfort measures only. The respiratory therapist is not going to be required for this patient. The respiratory therapist is in charge of advancing the airways, opening up the airways to make sure that proper ventilation is always happening for our patients. We're supporting the respiratory needs. If a patient is comfort care only, there's not going to be breathing treatments, steroids, ventilation happening for this client. So just in general, guys, make the connection that the interdisciplinary team is used to promote safe patient care. Safe patient care, not unnecessary, but safe. All right. Let's go into the case study. I love doing case studies. Let me just say this. Case studies are really the best way to determine or evaluate if a nursing student is competent in an area that they've studied, because case studies will literally take you from the beginning of a patient and move you through their care. So let's see how you guys do with this case study. We have a 63-year-old male is admitted to the medical surgical unit after an emergency pleural biopsy and thoracic ultrasound. The client has a closed drainage chest tube on the right side. He reports no pain and is currently in stable condition. Okay, do we have our patient here? 63-year-old male admitted to the medical surgical unit after an emergency pleural biopsy and thoracic ultrasound. The client has a closed drainage chest tube on the right side. He reports no pain and is currently in stable condition. Okay, so first question, which of the following is an expected auscultation finding involving a collapsed lung? Number one, is it adventitious breath sounds? 2, rhonchi. 3, absent breath sounds. Or 4, stridor. I'm looking for the most appropriate, the one that's going to be directly correlated to a collapsed lung. What would you guys think? All right. Content based. Here we go. The correct answer, I see the answers coming in. The correct answer is actually yes. Number 3, absent breath sounds. This is what you're going to see if you have a collapsed lung. There's no air exchange going on here. Let me ask you this. What is another name for a collapsed lung? What do we call it? What do we need to study if we're talking about collapsed lung? If you didn't get this run right, these are the terms that you want to study. And they are essentially that, a pneumothorax or atelectasis. And these are important terms for you to study because these are considered respiratory emergencies. If a patient has atelectasis or a pneumothorax, then they require immediate assistance. I'm looking in the VT student workbook because I know I go over both of these with you guys. And so I just want to give you a shout out. For the RN NCLEX virtual trainer, this will be on page 101 where you will study about the tension pneumothorax. And it's going to be super helpful to you guys. So I love to see your notes that you take on the subject. Sometimes I'll go into your student account and I just look around to see what notes you're taking and then how you're progressing through the information. So shout out pneumothorax atelectasis. All right, let's look at another follow-up question on our patient. We know that they had a collapsed lung, so you know what they get? They're gonna get a chest tube. Chest tubes also we talk about in the VT. So here's the question. At the start of the shift, the client had 50 milliliters of drainage in the closed chest tube system. After 3 hours, the nurse notes the following. Which action should the nurse take? All right, so at the start of the shift, all right, you see that there's a 50 at the marker. Now 3 hours later, look at where the drainage is. Take a good look. So my question is, and I'm gonna give you 2 choices. What action should the nurse take? Is it 1 or 2? 1 says document the finding because she's recorded the finding. 2 says notify the healthcare provider. What sayeth you all? What should the nurse do? Is this a normal amount of drainage? Is it too much? I mean, if you call the healthcare provider, are they going to be upset that you called them? What do you think? Okay. The correct answer is actually great job. Great job. Thank you for all the responses. The correct answer is 2. Yeah, it's simply notify that healthcare provider, because when you're talking about the drainage that comes from a closed chest tube system, the maximum that you want to see is 100 per hour. The maximum that you want to see is 100 per hour. And this patient, starting at 50 and then at the next evaluation is up to 500, you know, this patient is obviously hemorrhaging from their chest tube site area. So we got to call the physician. We got to notify the healthcare provider on this. Okay, guys, so we know our patient situation. Let's keep on going with our case study here. The healthcare provider, this is question number 3. The healthcare provider has ordered a computerized tomography scan, CT scan. The priority nursing action during transportation with the chest tube in situ is which of the following? Number 1, monitor the client's level of pain. 2, keep the client NPO before the exam. 3, reinforce the dressing at the insertion site before transportation. Or 4, keep the chest tube upright and below the level of insertion. So during transportation, which one of these actions is going to be the most important? Which one is the priority? And if you've never been in this situation before, where you've transported a client with a chest tube, well, you have to think, okay, how can my patient most harmed? How can my patient be most at risk for an adverse effect of having this chest tube? That's how I want you to think about it. All right. So let's look at the options again. During transportation, should the nurse monitor the client's level of pain? 2, keep the client NPO before the exam. 3, reinforce the dressing at the insertion site before transportation. Or 4, keep the chest tube upright and below the level of insertion. So all of these options sound good, but the correct answer is going to be number 4, keeping that chest tube upright and below the level of insertion will help the patient not have any other issues with the tension pneumothorax, okay? And so that's the safety protocol. Let's go to question number 4, all right? And you guys are doing well. No matter what, you showed up. That's the hardest part of studying, is just showing up. There's so many people. Let me just say this, interjection here. There's so many people that should be here because they haven't been studying for NCLEX, but they want to pass. But you actually made it here and you're studying. So you're doing well. Number 4, while standing for proper positioning during the CT scan, the client's chest tube becomes dislodged. Which is the priority action by the nurse? Number 1, clamp the chest tube at the base of the unit. 2, notify the healthcare provider. 3, reinforce the dressing at the insertion site before transportation. Or 4, keep the chest tube upright and below the level of insertion. Okay? What is going to be the priority nursing action? And the correct answer is notify the healthcare provider. All right? And this is going to be the most important action here from the choices that you're given. All right, from the choices that you're given. Now, I know that you may be saying, well, hey, why doesn't it say cover the spot with an occlusive dressing? And the reason why it doesn't say that here is because when we're taking NCLEX, sometimes in our mind, we already want to have an answer for the questions. So, and exam writers like myself know that you already have your preconceived answer already in your mind. So what we do is we introduce different options. So you have to think, well, gosh, why didn't it say what I studied to do? So it's like, okay, if we knock off that answer choice from the nursing student, what do they have to fall back on? What is the most important thing for them to do? So here, from the options that you have listed, looking here, the most important thing for you to do, instead of clamping the chest tube at the base, keeping the chest tube upright, right, is to notify the healthcare provider, all right? Now, here's the priority nursing actions. When there is a chest tube that's dislodged, here they go. So the exact order would be cover the opening with a gloved hand, okay? Because you might not have a dressing already ready to go. So you would cover it with a gloved hand. Then you would apply an occlusive dressing, taping it on 3 sides only, just like you have here, and then you would notify the healthcare provider, all right? But remember, for your NCLEX exam, pick the best choice from the options you are given. Do not lament something that you think should have been there, all right? Just look at what you have, pick the best choices, and move forward, all right? You guys can do this. The next question says, all right, so that's our case study. We're going on to a new patient here, and it says, a nurse is caring for a client with a nasogastric tube. The nurse is caring for a client with a nasogastric tube. The healthcare provider has ordered this intervention to assist with decompression, all right? So which of the following is the most important action for the nurse to take? And the choices are, number 1, discontinue wall suction during treatment times. 2, discontinue wall suction when the client complains of pain. 3, maintain a semi-Fowler's position. Or 4, provide protection care to the nares every 8 hours. What are we doing for our patient that's going to be the most appropriate and the most important action for the nurse to take? I know, everybody, give it your best shot. Even if you feel like you're between 2, go ahead and choose one option, all right? And let's see if you can just get it. The correct option for this question, the answer choice that is the most appropriate, most important, is maintaining a semi-Fowler's position. The nurse should not do any of the other things, all right? It is not okay. It is not okay for the nurse to turn off wall suction. You cannot do that as part of the prescribed treatment. Even if the client is complaining of pain, you cannot turn it off or turn it down, because if you do that, you can create other issues in the patient. So it's best to get direction from the healthcare provider, all right? And then providing care to the nares every 8 hours, well, that's just too far in between treatment times. It definitely needs to be more frequent than that, all right? So for some hospital facilities, it's every 2 hours. Some may be every 4 hours, but definitely every 8 hours is way too long for the skin of the nares, which is very sensitive. So remember, the semi-Fowler's position really is going to help maximize air exchange. It's going to relax the abdominal contents, and this will be the best position for a client in order to feel some relief in their abdominal area. All right, I got more questions for you guys. I hope you can handle them. I hope you are enjoying this studying session. Here we go. Question number 6. Ooh. A client with a heroin addiction admits to frequent relapses. The client states, all people with addiction have relapses. This is normal. The nurse is aware this statement is an example of, number 1, sublimation, 2, denial, 3, rationalization, or 4, anger. So we moved it into substance abuse. We moved it into psych. What do you guys think is the correct answer? If you have in your mind the word rationalization, then you are on the right track. Great job. Sublimation, if you didn't know, means turning a negative socially unacceptable impulse into a positive one. So, for example, if you have a client that swears, or if you have a client that steals, that's something that socially most people would not condone, they do not do, but the patient makes it into a positive and they say, hey, this is who I am, this is me, this is how I benefit from acting or behaving this way. Denial is declaring something to be untrue. Anger is a strong feeling of annoyance, displeasure, or hostility. So the best answer for this choice is the rationalization. Question number 7 says this: a 38-year-old client newly diagnosed with stomach cancer only has a few months to live. After a severe episode of pyrosis and indigestion, the client states, "This is just heartburn. I will be fine in a few hours." Which is the best response by the nurse? Is it, "You are avoiding the truth. This is stomach cancer"? Or is it 2, "It is stomach cancer that you are experiencing"? 3 says, "You are in denial. The healthcare provider told you that your diagnosis was stomach cancer." 4 says, "Tell me more about your illness." 5 says, "I will ask the healthcare provider to come back in and speak to you." So here we have a little therapeutic communication. What is the best response of the nurse to give to a client who literally has stomach cancer, dying in a few months? That's what they told them. But they say, you know what, this is just heartburn and I'll be fine. The correct statement, the correct response for the nurse to make is, "Tell me more about your illness." And this only makes sense because when you're talking about therapeutic communications for NCLEX, you want the statement that is going to allow the client to express their emotions, to develop their emotions in a non-judgmental way. So the other options have the nurse saying, look, attacking the patient. "You're in denial. You're avoiding the truth. This is stomach cancer. I'm gonna have the doctor get back on you." So we want to be as non-judgmental and receptive to hearing as possible. I like question number 8. It simply says, a nurse is preparing to discharge a refugee living alone in Canada. The client does have a son. Okay. Yep. Question number 8, I like it a lot. It says, a nurse is preparing to discharge a refugee living alone in Canada. The client does have a son who lives in a nearby province. The client will need help with daily personal care. Which of the following is most appropriate action to include in the discharge planning? Which of the following is the most appropriate action to include in the discharge planning? Is it number 1, assess the client's ability to have close neighbors offer assistance? 2, consult with social work for a long-term placement admission? 3, recommend to have a skilled healthcare worker provide in-home care? Or 4, recommend to have the son stay with the father for a few days? Okay, so you have a refugee who is living by themselves in Canada, but they do have a son who lives in a nearby province. So when you're talking about discharge care to somebody who's going to need help, what is the most appropriate action for this nurse to do? And I see a lot of the answers that you're putting up answers on the screen, but actually the correct idea is that number 3, recommend to have a skilled healthcare worker provide in-home care. Yes, because honestly, you cannot assume that this patient who already is living alone will have consistent help. What do we know? You don't really want to ask if the neighbors are willing to provide you daily care. That's not their responsibility, right? A long-term placement admission. Well, this patient doesn't need quite that at this time. All they need help with is daily personal care. So putting them in a long-term care facility is not going to be appropriate. And then 4, even though it sounds good because it incorporates the family, you don't really know the relationship with the son. And asking or recommending that the son stay with the father for a few days is not going to be an appropriate solution for somebody who needs daily personal care. So the best reaction, the best goal is to have somebody come in there who can provide skilled care to this patient who's already in their home. That's going to be the best. Okay, let's do question number 9. A nurse is caring for a client 2 days post-operative, a left hip replacement. Upon entering the room, the client tells the nurse, "I have completed my incentive spirometry and deep breathing exercise as you requested." Which is the best response by the nurse? Okay, number 1, document the statement in the nurse's notes. 2, ask the client to explain how he completed the procedure. 3, encourage the client to notify the nurse when doing the incentive spirometry and deep breathing exercises. Or 4, request the client repeat the treatments in her presence. So just to set the picture, you have a patient, they had surgery, all right? They had a hip replacement. They were told that they would be doing deep breathing and incentive spirometry exercises. So while the nurse leaves the room, when the nurse returns, the patient says, "Hey, I already did it. I did it on my own." What's the best thing for the nurse to do? Here are our choices. Do you just document the statement in the nurse's notes? Say, "Hey, the patient said they did it." Do you 2, ask the patient, "Tell me exactly how you did the procedure. Explain to me how you did it." 3, do you tell the patient, encourage them, "Hey, next time you do that, notify me. You need to notify me when you're doing incentive spirometry and deep breathing." Or 4, request that the client repeat the treatments in her presence. So actually have the client do them again. Oh, which one is going to be best for the nurse to do? I know you guys have it. You guys have it. Which one makes sense? Which one is the safest action? The correct answer is you're going to have that client do that procedure in front of you again, because then you'll be able to appropriately document that it was done. All right. Everything else just relies on the patient's word, and as a nurse, you have to take these treatments serious if you're going to sign off on them. All right. All right, guys, last question here. Question number 10. A nurse is attending an educational conference on the possible dangers of narcotic treatments in certain populations. Our narcotic medication should be avoided in which client? Our 4 choices are: number 1, the client with a history of alcohol abuse. 2, the client with a neurological impairment. 3, the client refusing to participate in education regarding his current medications. Or 4, the client with rectal bleeding. Right, what do you guys think? And the correct answer is going to be, no doubt, client number 2, the client with a neurological impairment, knowing that narcotics are going to diminish the current level of consciousness and possibly the pupil response, right? So we don't want to give narcotics in clients who have neurological deficits, all right? Because that's going to make them harder to treat, harder to assess, harder to evaluate. Hey, guess what? We are not done. We're getting ready to go into another level, but I want to tell you guys, this is the biggest discount you can get right now for this full NCLEX review. It comes with the NCLEX Virtual Trainer Workbook as well as the 5-star quick facts. I really just want to encourage you guys, just feel the difference of when you've studied for a subject and how good you feel about it when you answer questions. And the virtual trainer is the most advanced, it is the most unique, it is the very best to prepare you. 6 weeks you can get your license. 6 weeks, guys. All right, guys, we had such a great time, but I want to do something different. I want to take you inside of the virtual trainer. And I took a page from the virtual trainer workbook and put it inside of your 7 days workbook. So now you'll be able to see what a full NCLEX lecture feels like, sounds like, and how you can use it to pass your exam. We have over 1,000 Remar nurses studying in the NCLEX virtual trainer right now. Wouldn't you like to be one of them? So let's take a look inside the virtual trainer. Welcome to your chest tubes overview. You know, chest tubes are seen no matter where you will work in nursing, from surgical to geriatrics to ICU. Let's talk about what a chest tube is. A chest tube is a one-way drain that allows fluid or air to escape the pleural space. Remember, normal breathing works on negative pressure. And negative pressure, if I try to explain it, it's the idea that when humans inhale, it's a result of the diaphragm contracting and moving down while the rib muscles move out. So all of these things cause the lungs to expand. The pressure inside the lungs drop, which allows the air to come in, and that's why we call it negative pressure. It's just the way the humans suck air in. Chest tubes are needed whenever the negative pressure in the pleural space is disrupted. Now let's get into an emergency that would require a chest tube. What I want to look at is the tension pneumothorax. And you may have learned this in nursing school, but we're going to review it here. The tension pneumothorax is when air is in between the lung and chest wall. This may be caused by a trauma, a surgery, sometimes a fall. Anyways, what happens is there is outside air inside of the pleural space, and that air is coming in, but it's not able to get out. So for NCLEX, you do have to understand the tension pneumothorax, but also you have to be able to identify when a client is experiencing a tension pneumothorax. So let's go over this chart here. These are the classic signs of a tension pneumothorax. Trachea deviation. If you look at the x-ray on your page, you will see that this client has tracheal deviation. So write yes across from the box. It's a classic sign for you to know if a tension pneumothorax is present. Now, the blood pressure of this client, just looking at the x-ray, you tell me, would we expect the blood pressure to be up or down? We're going to expect this blood pressure to be down. The patient will be in shock. So because the blood pressure is down, what will the heart rate do? The heart rate will go up, yes, to compensate. Now, lung expansion, it will be unequal, but on the affected side, do you think the lung expansion is going to be up or down? It's going to be down. The lung expansion is absolutely going to be decreased. What about oxygenation for this patient? Will they have a healthy oxygenation? Will it be up or will it be down? It's going to be down, yes, again. Now, the jugular veins, will they be distended or will they be decreased? What do you think? They're going to be up. Yes, they're going to be distended jugular veins with the tension pneumothorax. So, how do we treat this? How do we treat the tension pneumothorax? Because it is a medical emergency. The client needs treatment right away. The treatment of the tension pneumothorax is a needle decompression. Yes, a needle decompression into the second intercostal space. So now that you have that emergency out of the way, what typically happens is after the needle decompression Air will come out of the patient, maybe sometimes even fluid will come out of the patient after the needle decompression, but we cannot continue to do needle decompressions every several hours. We need something else to continue to draw the air and the fluid out of the client. And what that treatment is a chest tube. So you have to understand how the 3 chambers of the chest tube system work together. So we're going to move into our chest tube setup lecture right now. We're going to look at the 3 chambers. We have a collection chamber, a water seal chamber, and then the suction control chamber. Let's look at how to manage the collection chamber. The purpose of the collection chamber is to collect fluid, is to collect the fluid or the blood that comes out. Now, we want to notify the doctor if the drainage is 2 things, okay? First, we want to notify the doctor if the drainage is bright red, because bright red blood is new blood, is fresh blood. It indicates that the client is actively bleeding. We also want to notify the doctor if the blood or the drainage is greater than 100 milliliters per hour. What's the issue with a greater than 100 milliliters per hour blood or fluid return? It means that your patient again is bleeding out. So these are 2 things that nurses want to look out for. Now remember, the collection chamber is a way for us to monitor how much fluid is coming out of our client. So we never would want to empty it or dump it out. Let's move on to the next chamber, which is the water seal chamber. The water seal chamber is called the water seal chamber because it actually has water in it that you will be able to visibly see, about 2 centimeters of water. Now, the purpose is to allow air to exit from the pleural space during exhalation and prevent air to enter the pleural space during inhalation. So the question always in the water, should you see bubbling? Should you not see bubbling? Some resources will call it tidling. Should you see tidling? Should you not see tidling? So continuous bubbling or tidling is a bad sign. It means that there is an air leak. You do not want to see that. What you want to see is intermittent tidling. That's a good sign. That means the water seal chamber is working effectively. Now let's look at the suction control chamber. The suction chamber determines how much suction is being applied to your patient. Now it's the doctor or the healthcare provider that orders that. We as nurses, we cannot alter it, we cannot change it. But the suction control chamber also has water in it. So the question is, should there be bubbling or tidling? Should there not be bubbling or tidling? For the suction control chamber, it's just the opposite. Continuous bubbling is a great sign. It shows that the suction is on and it's working. Intermittent bubbling is a bad sign. It means that the suction is not working properly. So let's look at the care of a client with a chest tube. Number 1, we need to assess the client for respiratory distress, breath sounds, and stable vital signs. The chest tube should be above or below the chest level. What do you think? The chest tube should be placed below the chest level. Yes. Number 3, do not milk or strip a chest tube without a doctor's order. 4, daily chest x-rays are needed to check for fluid removal. 5, clients will have an occlusive dressing at the insertion site. 6, never clamp a chest tube without a doctor's order. Now, here are some common NCLEX troubleshooting scenarios that you will be placed in. Let's talk about what you are going to do. So, number 1, if we notice that the water seal is broken, if we see that continuous bubbling, we're going to recreate a new water seal. The way we do that is we place, this is A, I want you to write this down, place the distal end of the tube and 2 centimeters of sterile water. That's it. And then the second scenario, if the client accidentally pulls his chest tube out, of course we're going to stay calm as the nurse. We're going to A, use a gloved hand. B, cover the opening with an occlusive dressing. And then C, tape the dressing on 3 sides only, not 4, just 3, so that we can allow air to escape, and that will prevent a tension pneumothorax. Now, let me just go back and say something. When I'm saying an occlusive dressing, what's the difference between a regular sterile dressing and an occlusive dressing? What do you guys think? Well, the occlusive dressing blocks air from coming through the fibers. So an occlusive dressing will typically have petroleum jelly all over it. So when you open it up from the packaging, it will be all sticky because the dressing will actually be covered front and back with petroleum jelly. And that's what makes it occlusive. The third scenario that we have here is that the client complains of pain and they won't comply with any of the doctor's orders. If they're in pain and they won't walk, they won't do their incentive spirometry, what do? We medicate the client and then have them to cough and deep breathe. All right. So A, you medicate the client and then you have to teach them to cough and deep breathe to prevent atelectasis. Now, in a perfect NCLEX world, you will have at the bedside of a client with a chest tube these 3 things always. Number 1, you will have that occlusive dressing ready to go. 2, you will have sterile water. And 3, you will have a chest tube clamp. So let's do some more critical thinking to just test what we've learned. And I want you to attempt to do these questions by yourself and then come back with me to go over them. Number 1, what kind of lung sounds would the nurse expect to hear with a client who needs a chest tube? And this is a select all that apply. The options are number 1, wheezes, 2, crackles, 3, stridor, 4, diminished, or 5, pleural friction rub. The correct answers are number 2, crackles, which indicates an excessive amount of fluid with a chest tube would help. 4 is diminished, and diminished lung sounds usually indicate that air or fluid is in or around the lungs. So chest tubes would also help this condition. Now, the wheezing, the stridor, and the pleural friction rub are caused by things that a chest tube is not going to correct. So let's go on to the next question. When caring for a client with a chest tube, what should the nurse do to evaluate the effectiveness of the chest tube? Choices are number 1, empty the chest tube drainage every shift. 2, mark the chest tube drainage every shift. 3, clamp the chest tube when transferring the client. 4, add water to the water chamber when she notices it is low. The correct answer, mark that chest tube drainage after every shift. 3, what should be done once the fluid in the water seal chamber no longer fluctuates with inspiration or expiration? What's happening? Now, you don't see any movement in the water seal chamber. Normally, it's either continuously bubbling or intermittently bubbling, but now there is no movement. What we need to do is assess the client, assess the chest tube, but assess the client because possibly the chest tube can be removed. If there's no more air exchange, then maybe there's no more air in that pleural space. The chest tube can be removed. Number 4, after a client has his chest tube removed by the healthcare provider, which dressing should the nurse have ready to place over the incision site? So we're looking for a what here? An occlusive dressing, and it is going to be the Xeroform petroleum dressing should be at that insertion site. Hey guys, I just wanted to let you know the fun is not over yet. That's right, this review is still going on. We have another 6 episodes. Next episode, we will be talking about hot topics for NCLEX. You don't want to miss it. When I say hot topics, I'm telling you, these are the things that you want to know before you take that test. I can't wait for you guys to study with me again. I can, I will, I must pass NCLEX. I can, I will, and I must pass NCLEX.
Hey everybody, welcome to REMAR Review. My name is Mark Callie and I am the president of REMAR. Hey Mark, are you a nurse? Well, it's funny that you might ask. The answer is no, I'm not a nurse. I don't have any medical training, but I did have enough sense to marry a beautiful nurse. And so at REMAR Review, we believe in spiritual development. We want to give you the best of what we have to help you on this journey. Hey, did you know that hospitals have chaplains? Hospitals have chaplains because whenever you're on a difficult journey of life, it's important to have spiritual development and guidance as a part of the process. So if you would just allow us to pray with you, and we want to get started. Father in heaven, I ask that you would bless each and every one under the sound of my voice that is listening to this broadcast, that is watching this, and that they are looking to get their nursing license. I ask that you would be with them on the process, be their guide, be their shepherd. In Jesus' name, amen. If you receive that, let's go ahead and get started. All right, guys, you've done great so far with your studying. Now it's time for some spiritual development. Hey, did you know that hospitals have chaplains? We want to make sure that we're meeting your needs, not only on the educational side, but also on the spiritual side as well. And so I want to share a story with you about what I like to call incremental healing. This comes from the book of Mark in chapter 8, starting with verse 22. And the Bible says, "And Jesus came to Bethesda, and they brought a blind man to him and asked him to touch him. And he took the blind man by hand and led him out of the town. And when he had spit on his eyes and put his hands upon him, he asked him if he could see anything. And the man looked up and he said, 'I see men walking around as trees.' And after that, he, being Jesus, put his hands again upon his eyes and made him look up. And he was restored, and he saw every man clearly." I love that story. I love that story. This is a story of what I like to call incremental healings or incremental blessings. Now get this, the man is blind, he can't see anything. And so his friends brought him to Jesus and says, "Jesus, can you touch him? Can you heal him? Can you lay hands on him?" And Jesus, he did just that. So Jesus spit on his hands, he touched his eyes, and then he says, "What do you see? Can you see anything?" And the blind man says, "You know what? I see things a little bit better now. It's a little bit more clear than it was before, but it's not really clear all the way." He says, "I see men walking around as trees." And you can imagine if he's in the mind of the blind man, he's thinking like, well, this is better than what I was, but I don't know, if this is all that I'm going to be able to do. And so what Jesus did he did something very special. He reached out and he touched the man again. But the Bible says, before he touched him again, he says he caused him to look up. He caused him to look up. In other words, not to think about the situation as it was, not to dwell on what was beneath, but to think on the things that are above. And so right now, if you're studying for NCLEX and things aren't as clear as you think they should be, you see these questions as confusing, or you see this test as through the lens of anxiety or doubt, what we want you to do is to say a prayer that Jesus would touch you in that process. And I know a lot of you are already praying, but even if you are praying, it's important to stay there and ask God to touch you yet again. You are in the right place. We just need you to adjust your eyes and look up and let Jesus touch you again. This is what I want you to remember. Even when connected to God and on the right path, you may not understand everything right away. That's when you need to look for the incremental blessings that become clearer and clearer and clearer as long as you stay connected. Yes, my friends, that's the key, is staying connected to Christ as things become clearer and clearer. And remember to look up, look up, look up. Because with God, it's possible. You can, you will, and you must pass NCLEX.
Hey, Mark. My name is Mary. I took my PN NCLEX on Monday, December the 2nd, and successfully I passed. The minimum questions were 85, and I got the minimum. Yay! I studied with Remar, of course, and I also did the scary topics review, and I also did the Black Friday review. Some of the exact stuff from that review came up on that NCLEX. I'm very thankful that I took the time out to study, which I didn't do the 6 weeks. I actually took 4 weeks and did it. I've been out of school since August, and all I've been doing is working like crazy to catch up on bills and all that stuff. But I took a month aside to study in between. Remar was really helpful, gave me a better understanding and much clearer. Like, I like the way Regina broke stuff down, and I just got a better understanding of it. I'm so happy, and I am excited to get started on my nursing career, and I look forward to becoming an RN next. Thank you, Mark and Regina.
There is a way to study for NCLEX by focusing on the content, and I'm going to show you how it's done. Go ahead and get out your downloadable workbook so we can take notes. All of the information today is coming from our NCLEX virtual trainer. That's right, you're going to see this amazing program and how beneficial it is to help you get your nursing license. The NCLEX virtual trainer, this is the best resource I've ever created for nursing students to pass their exam. All of the Remar nurses are in it right now. They're loving it, and I want you to have it too. We cut the price to just $150 so you didn't have any excuse why you couldn't get this amazing resource. 2020 is coming up. I want you to have your license. I created this amazing product so you can take control of your learning experience. Let's make NCLEX preparation easy. Get the virtual trainer. We have it while supplies last. It's just $150. I'm so excited for you to get your license this year. Oh, it's going to be an exciting class. Let's get started right away. I'm so excited about episode 2 because not only do I get to give you information from the virtual trainer, but I get to tell you about the hot topics on NCLEX. These are the topics that you want to know before you take the exam. So let's get into it. Hot topics. Let's get started. Number 1 hot topics, what do we do about these clients with AIDS or HIV? There are some parameters that you need to know, and you have to be able to care for them appropriately. Remember, HIV, AIDS, these come from blood-borne pathogens. Now, if you've been exposed to this virus, usually your symptoms begin after about 3 weeks. So during the time when a client doesn't have symptoms, they are highly likely to pass this virus on to other unsuspecting associates, sexual partners, even children, for mothers who have the virus. And so it's very important for us to know that they require special types of care and standards. Let me ask you this, and this is perfect for NCLEX. What are the 2 viruses that cause HIV to replicate faster? What are the 2 viruses that cause HIV to replicate faster? Hello, all my Remar nurses. I'm so happy that you're here with me today. I kind of gave clues. I don't know if you can see them or make them out in your mind, but they are, this is hot topics. Herpes simplex and cytomegalovirus. And these 2 actually help to influence the replication of the HIV virus. Yeah. Let's stay some more, and these are notes here. Let's stay more on the HIV client. And again, if you have your, let me just show you this. If you have your worksheet for today under hot topics, you will see that I've already printed out like structures of the notes. So you're just filling in the boxes, and then you're going to be answering these questions here. Okay? All right. All right. So here we go. The client with AIDS or HIV, I have here the pediatric population here. So this would include infants born to infected mothers, HIV-infected blood products. Maybe a child received some HIV-infected blood products, or if they are a victim of sexual abuse and they contracted HIV that way. Then this would encompass how the pediatric population would contract the HIV virus. Let me ask you a question. Which of the following children would be most dangerous to an HIV client? All right, if we had a client, they were a kid, and you had to do perhaps roommate assignments, which of the following would be most dangerous to our HIV client? Would it be number 1, the child with varicella, 2, the child with influenza, 3, the child with active bleeding, 4, the child with cystic fibrosis? Who's going to be most dangerous, thinking about what the client has and how they can harm our HIV client? The correct answer, I see it, the child with varicella. Shout out to all the REMAR nurses who are participating in this broadcast. Yes, because varicella, that's going to be a live virus, and it can definitely do danger to a patient who has a compromised immune cycle. Hey, let me ask you this question. We're talking about HIV clients, AIDS clients. Can they donate blood after their treatment has been started? This is a very hot topic for your NCLEX exam. Can they donate blood after treatment? All right. The answer is going to be no, not even years after treatment. And there's a lot of information on the news right now of how people are curing themselves of HIV. For our standards of care today, remember that they are not able to donate blood even after treatment. All right. So we don't have to worry about that. Now, the next hot topic that I want to go over is nursing students. Nursing students, you guys, on your NCLEX exam, you have to know your scope of practice. And it's very prudent, because we as nursing students, we're learning a whole bunch. We're learning about medications. We're even giving medications. We're starting IVs. Shout out to all the nursing students in clinicals. You guys are doing it. You're doing very well. But for your NCLEX exam, if they asked you, what is the function, what are the responsibilities of a nursing student, I don't want you to think of, oh, this is somebody that can give medications. This is somebody that's being trained. No, it is essentially the activities of daily living. You guys know, as nursing students, you have the same responsibilities as the unlicensed assistive personnel. You're feeding, you're bathing, you're dressing the patient. That's what we're responsible for when we don't have a license. And so you have to be very careful, because you guys are not going to be giving medications for the NCLEX exam. You're not going to be starting IVs. All right. Here's another question. Can the nursing student delegate responsibilities? What do you think? Can the nursing student delegate responsibilities to other staff members? Oh my goodness, it's a no. It's a no. A no, no, no. Nursing students, they don't have a license. They cannot delegate. They can assist registered nurses. You guys can be given, like I said, the tasks of activities of daily living, but you should not be telling other staff members what to do as a nursing student. All right. And this is just really a quick review of your role as a nursing student and how you can help the other staff members. All right. 3, I want to talk about restraints here. There are 2 types of restraints. And the 2 types are chemical and physical that I want to address, but not so much the restraining, the different classifications of restraints, but just how do they get on patients, and what are the ideas of when you have to implement this kind of treatment. So the first question is this: any type of restraint can constitute false imprisonment. So whether you give somebody a medication and it causes them to be sedated, you can be sued for false imprisonment, okay? It's not just a physical restraint. How about this question? Can a registered nurse apply restraints without a doctor's order? This is hot topics for NCLEX. We're talking about number 3. Can a registered nurse apply restraints without a doctor's order? What do you guys think? Yes or no? You may be surprised, but the actual answer is yes. The actual answer is yes. Registered nurses can apply restraints without a doctor's order. Now, it is important that the registered nurse, after initiating restraints, they get an order from a doctor, but we can use our clinical judgment to determine, you know what, this patient is not safe. This patient is going to pull out their chest tube or their ventilator. I need to restrain them for their safety, and then I need to notify the doctor. So typically it's within 2 hours. You know, some facilities say, hey, you gotta get an order within an hour. But the idea is that you guys understand they're registered nurses. You can do this. Practical nurses, you cannot at the time, but the registered nurse can. And I'm sure the practical nurse can work with the registered nurse to say, hey, this patient needs to be restrained, okay? Can an unlicensed assistive personnel apply restraints without a doctor's order? All right, step out of what happens in the real world and the nursing homes and assisted livings. The correct answer for your board exam is going to be no. They should not do that, all right? So that's a quick overview of the restraints. And remember, for hot topics, I'm literally directing you guys to the topic and then the answer, because a lot of nurses find themselves in these situations when they become entry-level nurses. And so the board exam is going to ask you about these things, so I want you to have a better understanding. When you leave from studying with the REMAR, I want you to feel like that was time well worth the investment, because this is an investment of time, and I'm so proud of you guys for being here. This is like one of my funnest times of the year. All right, we're going to talk about comfort measures only, and if you remember in episode 1, we had a question about comfort measures in an interdisciplinary team, but I want to review exactly what consists of comfort measures. And so comfort measures usually come from the doctor. They usually come along with a do not resuscitate order. These are the general guidelines for addressing basically the end of life care. So let me just go over the things that a client can or cannot have during a comfort measures only. So I'm going to ask them in question forms just to see how well or how comfortable you guys are with this topic. So number 1 says, if a client has comfort measures only, can they eat what they want? Can they eat what they want? What do you guys think? The correct answer is yes, absolutely. They can eat what they want. Remember, this is the process normally right before you pass away. And so the appetite is normally depressed. If the client wants Jell-O, if they want graham crackers, if they want Skittles, just give it to them. They can typically eat what they want, all right? The use of supplemental oxygen, I got this question a lot from nursing students, and so I just wanted to address it because it's actually kind of tricky when it comes to comfort measure only care. And so before asking whether it's appropriate or not, you have to address whether the physician believes that oxygen usage prolongs life, or is it a matter of comfort care? And so you will find that for this, it's going to vary by the healthcare provider or the facility. This was the research that I found, and this is one of the troubling things with NCLEX, is that sometimes there are no specific best practice guidelines on certain things, and so the use of oxygen at the end of life is one of those really gray areas that I've found. So I will have to defer to this statement here. And it says, frequently oxygen is continued in patients who are deeply unconscious and in their final hours of life. So in general, you will find clients who have oxygen on even though they're considered to be just moments away from passing. And so this is the literature here indicates that opioids may provide better relief of shortness of breath than oxygen. Even though it says this, oxygen is still not taken away. So the science actually shows that opioids help reduce the feeling of shortness of breath or air hunger, but we are still going to more than likely leave the oxygen on the client. All right. Comfort measures only. So just to be clear, so there's no confusion, oxygen use and comfort measures only is facility dependent or physician dependent. But generally, clients will have oxygen in the end of life care. All right. Cool. All right. IV fluids. Are IV fluids included as part of an essential to comfort measures only? What do you say, Remar nurses? The answer is going to be no. IV fluids are used to prevent dehydration and also provide certain medications access to the body, but they are not necessary for a client to be comfortable overall. Okay. The next one, hey, cardiac monitoring. Are we going to use that for comfort measures only? This one should be clear cut as a no. Cardiac monitoring includes, the blood pressure. Oh no, not cardiac monitoring includes the blood pressure, but most monitoring in general. So we're not going to be doing temperature checks. We're not going to be checking blood pressures. If anything, we're not going to be checking oxygenation saturations. Like this type of monitoring is not done in comfort measures only. So if anything, the nurse may check a pulse just to kind of establish how effective the opioid medication is becoming, or to declare a patient dead or deceased. Okay, so no kind of EKGs are going to be done. No kind of telemetry is going to be put on the patient who has comfort measures only. Right. Dialysis for the comfort measures only. I just have to go over these. Everybody should be screaming at the computer, the television, the phone. No, we're not going to do that. No dialysis and or diuretics will be given, and the purpose of them is going to be kind of the same, to keep that fluid off. How about nausea medication? Will we give that to our clients? Absolutely. Nausea medication will actually help the patient to be more comfortable. So that is something that we want to give to our patients, okay? So comfort measures only, we did that review. I just want you guys to be capable of saying yes or no if it's a select all that apply question you're presented with. Pain is going to be the next topic. Remember, pain is considered the fifth vital sign. There are two types of pain that I want you to be aware of, and they are, write them down. They're acute pain, which lasts less than 30 days after an injury. It's considered acute. Chronic pain is the pain that continues with you for a duration of 6 months or longer after an injury or an event. All right. So I have here some examples of different types of pain. I just want you to tell me if it's an A or a C, if it's an acute or if it's a chronic pain. Let's play this. Let's play this here. Number one, surgical pain. Is that acute or chronic? Type it really fast. Everybody type. And I want to see a whole bunch of A's. It's A pain. The next one, migraine, A or C. Is it A or C, acute or chronic? Yes, everybody, it is chronic. All right. How about this? Labor pain, childbirth, delivery. What kind of pain would that be described as? A or C? Correct answer is A, of course. All right. How about this? Renal calculus. Renal calculus. A or C, acute or chronic pain? This one is going to be fantastic. This is acute pain, rheumatoid pain. Here we go. Rheumatoid pain. What do you guys think this is? A or C? Rheumatoid pain is going to be chronic pain. Chronic pain. All right. So great overview. Now, there are 5 factors that affect pain. And I have started here the list for you, but these are factors that's going to affect, they're really going to affect how your patient perceives pain, how they describe it, whether they will report it to you or not. That's the important point here. So number 1, gender. Okay. Men typically have a lower tolerance for pain than women. Okay. That's just the truth of the matter, but men may underreport their pain. They may be in pain and not tell you. The second one is anxiety. Clients who are anxious tend to experience a higher level of pain than what they actually can tolerate. All right. 3, culture. Some cultures will disapprove of patients complaining of pain, or yeah, basically that's all I want to say. Some cultures, you will have a less frequency of reporting pain. Clients who have an altered level of consciousness, they tend to not be able to give you their pain scale rating. You have to think, is my patient in pain? You really have to think for them. And then communication barriers, not trusting the nurse to do something about the pain, not trusting the nurse to come back. Different languages will help to facilitate whether a patient reports their pain or not. So these are factors that are going to affect pain perception. All right. Hot topics for NCLEX. Oh, we got to keep going. The next topic is the spiritual assessment. And I know some people are like, what? What is that? The spiritual assessment is something that is part of that integrated processes that I told you we have to know. And so there are 4 questions that will help you to identify or evaluate your client's pain. All right. First question here, I like to use the FICA scale. The first question is about your faith. We ask patients, do you have a spiritual belief? Okay. Faith. Do you have a spiritual belief? The second question is this. How important is faith in your life? Okay. And this helps you to evaluate a priority. Okay. How important is faith in your life? Is it very important? You're practicing, you believe it every day, or is it not as important as some people may think it is, right? You have to be able to listen to your patient while they tell you this. The C is community. Do you find support in a community of faith? Would you like for the chaplain to visit you? These are questions, right? Do you have a community? Do you have a pastor? Will there be church members? Will there be faith members visiting you? Will the choir come? Right? Spiritual assessments. And then finally, A is, how would you like for me to address this issue? What can I do as the nurse to facilitate this issue? Okay. All right. Hey, we are moving on to our next hot topic. Is topic number 7 of 8, chain of infection. All right. I'm telling you, put a big star by this. If you're not in the virtual trainer, put a big star in this, because this is something you have to know, you have to have memorized. If you're in the VT, you guys know in the before the books arrive section, I put this on here. You need to know the order of the cycle. All right, here it is. Write down the chain of infection as it is presented to you right here. All right. The very first thing that you have as part of the chain is pathogen. Then there is a reservoir. 3, you have a portal of exit. 4, you have a transmission. Okay. 5, a portal of entry. And then 6 is vulnerable host. 6 should be a vulnerable host there. All right, not just a vulnerable anything. You have a vulnerable host. All right. All right, so those are the parts of the chain of infections. Now, remember, if you need to know them so well that if they're mixed up, you can put them in order. And so that's the activity that I have in the virtual trainer for you guys. So be able to do this on your own as well. The last hot topic is, oh, here's another presentation of it, just so you guys know. Because some of you are visual learners, so I forgot that I threw this in for my visual learners that want to see how the cycle actually occurs. All right. Okay. The last topic is infant abduction. Infant abduction. And oh my goodness, this is actual footage of a woman who the police identified. She had a baby stuffed down in a bag. All right. So this happens. This is something that every nurse, no matter where you work, you need to be able to identify what your role is during an infant abduction or how to prevent it. So the first thing that I want to say is this: as registered nurses, practical nurses working in a maternity unit, when babies are placed in a nursery, we never take out more than one at a time. Okay? Never take out more than one at a time. The second thing is that every infant, if it's out of a room, should be placed in a bassinet. Okay? Every infant should be in a bassinet in the hallway. This is how they're transported. Okay? Now, let me ask you guys this question. Here it is. Are mothers allowed to ambulate with infants in their arms outside of the room? Now, I know I just said that babies, when nurses have babies, they need to be in bassinets. But if the mom has a baby, can she carry the baby in the hallway in her arms if she just wants to walk with her baby? Can she do that? What do you guys say? The correct answer is no, they cannot. Even the mother, when she's in the hallway with her baby, that baby actually is this. The baby is supposed to be in a bassinet or in a car seat on its way out, but never in the mother's arms, okay? So that's the safety standard. That is the safety standard, all right? And then 2, what is the safe position for the infant in the room to prevent abduction? How do we position infants in a room in order to prevent abduction? And this is simply this. And I showed you a picture. On the side of the bed that is away from the door. So if you come into the room, the baby should be on the side of the bed towards the back of the room or towards the window. And that's the answer that you want to have for your NCLEX exam. All right? So hot topics for NCLEX. I love to do this quick overview with you guys because it just focuses your attention to certain points. And it's really super helpful to make sure that your studying is most effective. All right, guys, we had such a great time, but I want to do something different. I want to take you inside of the virtual trainer. And I took a page from the virtual trainer workbook and put it inside of your 7 days workbook. So now you'll be able to see what a full NCLEX lecture feels like, sounds like, and how you can use it to pass your exam. We have over 1,000 REMAR nurses studying in the NCLEX virtual trainer right now. Wouldn't you like to be one of them? So let's take a look inside the virtual trainer. Welcome to your pain management lecture. Let's get started. Pain, when you think of it, pain is subjective. It can feel different from client to client, and that just makes sense. What I consider to be acute pain, you may think is really nothing, and vice versa. Pain can be acute or chronic. So how do we rate pain? What is the best technique? For adults, it is the 0 to 10 scale. where you're using a numeric scale to ask for a rating. And again, if a patient says their pain is a 10 out of 10 and they're sitting in bed watching TV, you have to believe that for them, that pain is a 10 out of 10. For babies, it's best to use the FACES scale to record their pain. Now, in addition to asking your patient, or for babies using the FACES scale, there are other nonverbal cues of pain. And this is important when we think about how pain can be experienced differently based on culture, gender, and things like that. So right now, the nonverbal cues of pain are facial expressions. The body posture. For example, if a patient is protecting a painful area, even though they say they're not in pain, but they won't let you touch the area, that's a body posture cue of pain. Also, the activity level. When you're in pain, you're not going to be very active. And you also have increased vital signs during times of pain. Now, I alluded to this, but pain is experienced differently because of a few things. They are culture, religion. And remember, culture and religion are not the same things. Gender, age, anxiety, fear of drug abuse, desire to please the nurse or healthcare professionals. All of these things will alter how a client verbalizes pain to you or how they describe pain. A lot of patients come into the hospital with the need to be the good patient. And when they report pain, that might make them feel like they're being a bother or a nuisance to you as the nurse. So really help encourage the client that if they're in pain, they are free to report it to you. Now, how do we deal with pain? What are the routes for pain medication? They are an epidural, and when the term epidural is used, just know that it is a catheter that is inserted into the spinal space. So an epidural, oral route, transdermal, and transdermal means through the skin. Trans means through, dermal is the skin. So this is basically pain medication through a patch or a cream. And then the final one for NCLEX RN, we need to know about the PCA pump, which is an IV route of a medication. So here go some notes about the PCA pump that you need to know. Now, with the pump, the patient uses the pump that delivers medication when the client wants it. It's normally given for patients who have cancer and who have chronic pain, or after surgery when the pain is going to be very intense. Now, here is a critical thinking question for my REMAR nurses. For surgical clients who are going to get a PCA pump, should the nurse teach about the PCA pump before or after the surgery? What do you think? Should the nurse teach about the PCA pump before or after the surgery? The correct answer is before, of course, before the surgery, because after the surgery, the patient's going to be in pain. They're going to be recuperating from a procedure, so the learning will be down during that time. Now, for the PCA pumps, there are two things that you want to monitor. Number one, when a patient has access to their own pain medication when they want, you have to monitor for respirations. You have to monitor for respirations. You also, number two, have to watch if family members are pushing the pain control button. If family members are pushing the pain control button. And normally you will have family members to do this. And it really is according to your facility's policies if family members are allowed to push the PCA pump control button. Some facilities believe that if the patients can't get to it, the family members can assist. Others strongly support that if a patient is unconscious or sleeping, the pain button should not be pressed by the family member. So it is something that you want to monitor for and ask about. Okay, that wraps up our pain overview. We have to move on to the next subject.
Hi guys, I'm Regina. I am Simone Gardner. I'm an international RN nurse. I took NCLEX RN once and I failed. I saw the virtual trainer and I decided I had to get it. Being in the virtual trainer, it is very convenient. It is easy to navigate. It is full of content. The content is clear, it's very precise, easy to understand. What I love most about the virtual trainer is that when you go through the chapters and you do not get everything right, it doesn't allow you to go on. It forces you to know the content. Guys out there, if you haven't gotten the virtual trainers yet, please get it. You won't regret it. I have not regretted it since getting it. I have my virtual trainer, I have my ultimate package, I have my quick facts. I am on my way to success. I can, I will, and I must pass NCLEX. Thank you, Regina.
All right, Remar nurses, this is your season. This is the perfect time. Be nice to yourself during the holiday season. Give yourself the gift of passing NCLEX. This is 7 days of NCLEX, the perfect opportunity for you to do what needs to be done in order to pass NCLEX. I love seeing you guys. I love studying with you guys. Hey, we have episode 3 coming up. You don't want to miss it. You can, you will, and you must pass NCLEX. Welcome to the 7 days of NCLEX. My name is Regina, MSN RN, and I've dedicated the last 10 years of my life to helping students overcome anxiety, pass NCLEX, and get their nursing license. There is a way to study for NCLEX by focusing on the content, and I'm going to show you how it's done. Go ahead and get out your downloadable workbook so we can take notes. The NCLEX Virtual Trainer, this is the best resource I've ever created for nursing students to pass their exam. All of the Remar nurses are in it right now. They're loving it, and I want you to have it too. We cut the price to just $150 so you didn't have any excuse why you couldn't get this amazing resource. 2020 is coming up. I want you to have your license. I created this amazing product so you can take control of your learning experience. Let's make NCLEX preparation easy. Get the virtual trainer. We have it while supplies last. It's just $150. I'm so excited for you to get your license this year. Oh, it's going to be an exciting class. Let's get started right away. Okay, Remar nurses, Today, we are studying pharmacology, and this is a subject that universally nursing students struggle with, but I guarantee you today you will feel so much better based off of what we are studying. Right now, 7 days of NCLEX is all about making you comfortable to take your exam. So let's get right into it. We are going to focus on drug interactions for NCLEX. And when you think about drug interactions for NCLEX, this is a huge safety point for nurses because you need to know when you administer a medication, what are the potentials for adverse effects on that client. Now, there are 3 types of drugs and their interactions, and or you can say, you know what, I like to say there are 3 types of roles for medications. And I'm going to preface this by saying I'm making you dig a little deeper today. I'm giving you more background information so that when you study pharmacology on your own, or if you're studying in the virtual trainer, you're going to feel a lot more supported because you know this information. So write this down. We have 3 types of drug interactions here. The first group, the first class is called a substrate. Substrates. Then we're going to talk about inhibitors, and then we're going to talk about inducers. Okay, substrates, inhibitors, and inducers. Now, I don't want you guys to feel intimidated. Just go on this journey with me, all right? We're going to end up exactly where I want you to be. So we're going to talk about substrates first. This is our first classification that we wrote down. Now, essentially, substrates are metabolized by other medication enzymes. So they're drugs that are metabolized by other medication enzymes. So our primary medication that we're going to look at is digoxin, and it is a major substrate for NCLEX. So this means that when you give a patient digoxin, there's a potential for it to have an interaction with another medication because it's positively going to interact with that medication. Now, I won't get too much in detail with it. I want you guys to just keep taking notes because I'm taking you again, like I said, I want you to end up in a certain place. So when you think about substrates, here are medications that can increase the digoxin level. All right, so number 1 is verapamil. Now, what kind of medication is verapamil? 2 is spironolactone. Okay. 3 is going to be macrolides or mycin drugs like vancomycin. And then 4 is amiodarone. So here I am giving you a correlation between digoxin and other medications. And because digoxin is a substrate, if it comes in contact with another type of medication, it could potentially increase those levels in the bloodstream. And we know digoxin toxicity is a very real condition. So thinking about when you're studying pharmacology, it's very prudent for you to know what medications go together and what medications you cannot give. So we're going to focus on digoxin here. Let's get right into an NCLEX question. It says, a newly admitted client takes digoxin 0.25 milligrams a day. The nurse knows that which is the serum therapeutic level for digoxin. All right, so essentially I'm asking you guys, what is the normal range for digoxin in the blood? All right, if your patient is taking it, do you want it to be option number 1, 0.1 to 0.5 nanograms per milliliter? Is it 2, 0.5 to 2.0? Is it 3, 1.0 to 2.0? Or is it 4, 2.0 to 4.0? So this is definitely one of those facts that you need to know about this medication. What is the therapeutic range? So right now, I'm hoping that everyone is in accordance when they say it is Number 3, yes, 1 to 2. We want our clients' digoxin level to be about 1 to 2 so they don't have signs of digoxin toxicity. Now, if you are studying from the Quick Facts book, there is an entire section on your cardiac medications that you want to make sure that you have secured that knowledge, okay? So let's get back into it now. How about this? Before administering digoxin, what would be the most important to assess the client for? All right, before administering digoxin, what would be the most important to assess the client for? Is it number 1, hypocalcemia? 2, hyperkalemia. 3, hypotension. Or 4, atrial fibrillation. We're jumping right into this digoxin. You know, one of the things that you need to be able to do is know the very basics about medication. And so this is a test for us to recognize, hey, I need to study this some more, or I think I got it. All right. So the correct answer is going to be, yes, hypokalemia. Hypokalemia is going to increase the risk for digoxin toxicity. So when we talk about substrates and how vulnerable digoxin is as a medication, we have to know that if a patient's potassium level is low, then you can have risk for digoxin toxicity. So I found the quick facts for NCLEX. This is every nursing student's best friend. If you have the virtual trainer, you definitely have quick facts for NCLEX. And the digoxin section is on page 95. And I just want, just to make sure that I'm telling you guys all the contraindications about digoxin, so you can add this to your notes page as well. And I'm reading it right from the quick facts. So also, you guys know, before we give digoxin, what do we have to check? We have to check an apical pulse. Apical pulse. And depending on what is the age of the client will determine the holding rate of the pulse. So you take your apical pulse for 1 full minute before you give digoxin. And if the patient is over 8 years old, the holding rate will be 60, okay? All right, and then I mentioned signs of digoxin toxicity, but I wanted to make sure that you don't leave here without knowing what they are. So just quickly, your client will see what? Yellow spots, nausea and vomiting, and abdominal pain. Now remember, when you talk about the infants who have to take digoxin, remember, for infants, they're not going to be able to tell you if they have abdominal pain or not, right? You're not going to be able to ask an infant if they have yellow halos. So think about how the infant will present with digoxin toxicity. And I'm encouraging one of my REMAR nurses to actually put that down. Put the answer down if you know how infants present with digoxin toxicity. All right, let's get back into it. Love this quick facts book. All right, we're going to talk about major inhibitors. All right, so the substrate was digoxin. What about a major inhibitor? An inhibitor is just what it sounds like. So essentially, these drugs will stop a medication from working because the body will not be able to metabolize that medication. So does that make sense in terms of what an inhibitor will actually do? Let me tell you the medications that we need to look out for. They're there, okay? So I know that there is so many of us who have made note cards and flashcards that have grapefruit juice. Like, you cannot have grapefruit juice with certain medications, particularly if you're studying those cholesterol-lowering drugs. You know the grapefruit is a major inhibitor. Well, also is cyclosporine. And also cimetidine. What's cimetidine for? Yeah, we're taking that for our acid reflux, right, are gastric problems. And ditalizim is a cardiac medication. Well, these medications have the ability to prohibit other medications from doing their functions. So it's a big issue here. All right. The major inducers. All right. An inducer, what does that sound like? These medications will make another medication more potent because it will allow the body to metabolize it quicker. So what are the major inducers? Well, here they are. You guys would want to know about phenytoin. Phenytoin, spotlighted in quick facts. Phenobarbital as well. Rifampin. I'm telling you these medications, but as you're writing them down, I want you to say to yourself, do I know what these medications are for? Carbamazepine, amiodarone, St. John's wort. And you guys, I said it earlier, but I've literally been doing this for the last 10 years. So the things that I'm highlighting are, they're very significant in order for you to be able to understand as an entry-level or new nurse. The medications that I'm calling out here are not just some that I picked out from a drug book, but these are the ones that most new graduate nurses are reporting that they're working with, that they're seeing on their very first job. So it's important for us to be familiar with them. It's important for us to be comfortable speaking about them and how they affect other medications. So when you think about medications, we're talking about inducers, one of the major classes of medications that are really in relation to inducers is our MAOIs. MAOIs. Now, what is a MAOI used for? Where would we see that? What class would we be introduced to an MAOI at? Yes, we would be introduced to an MAOI during our psychiatric rotation. If you're doing the virtual trainer, you're going to be introduced to the MAOI during your psychological medications lecture. So MAOIs have some medications that you need to know that you can give with them, and medications that that will keep you from having the effects that you need to know, that you need to have. So the medications that are safe with the MAOIs are these. And I like this. It's IMAIL as the acronym, but it is, the I is going to stand for ibandronic acid, which is used for osteoporosis. And I'm not giving you, I'm only giving you the generic names. I'm not giving you the brand names because you need to know the generic names for NCLEX. The metoprolol, you can give that with the MAOI. The alprazolam, the lantoprost, and estrogen. And the reason why I'm telling you guys this is because when you are taking care of a psychiatric patient, do you guys know where psychiatric patients go first normally? Do you guys know what kind of unit you're going to see the psychiatric patient on first? Because sometimes they cannot go straight to the psychiatric unit because they do have a condition, right? So where do psychiatric patients go first when they're admitted to the hospital, right? So of course they go through the ER. Like, so if you go to the ER and you have a condition, say you're a psychiatric patient, and you have hypertension, right? So the very first days of your treatment, you're going to be on a medical surgical floor. So what the board is realizing is that it is very important for client safety for general nurses to know what medications are safe to give with antipsychotic medications. Because if you have a psych patient that has a history of bipolar disorder or depression, and all of a sudden you're trying to give them medication for hypertension, then you better know that metoprolol is safe to give with the MAOI, right? Because the MAOI, what kind of antidepressant is an MAOI? Is it a long-term or is it a short-term? Yeah, it's a long-term medication. So you can't just abruptly stop it. You have to continue the therapy, but you have to introduce new medications into this client's medication regimen. So that's why I hit so hard on the psychiatric medications in my lecture, because with MAOIs, it's very important what the client is eating as well, right? You can't have all types of food. So as the nurse, you get a psych patient in, you have to monitor their meal trays, right? Okay, so this is what it looks like to study content. It's definitely about learning new information and knowing where to put that information, all right? So let's look at some more medications that are going to cause effects of the body that we are not expecting to see. So I want to move to the ototoxic agents. Now, what is an ototoxic agent? When something's ototoxic, what is it going to damage? Yes, it's going to damage your patient's ears. It's going to reduce hearing, all right? And this is huge because your client does not come into the problem, your client doesn't come into the hospital with a problem. So we don't want them to leave with an issue they didn't have before they met you. And so when you talk about ototoxicity agents, you gotta know that furosemide, you have to be very careful with how much furosemide you give, how fast you give it. This is a very powerful diuretic, and it can affect the hearing. Also, your aminoglycosides. What are some examples of an aminoglycoside that you have to know for NCLEX? This is a class of antibiotics, but there's specific names that you want to know, and they are, somebody write them down for me, gentamicin, clindamycin, streptomycin. Yes, all of these mycins are actually from the class of aminoglycosides, and so they cause problems with hearing for your patient. Okay. Now, vancomycin is it's usually paired with the aminoglycosides, although it's not. It's a macrolide. But it will cause the ototoxic effect in your patients. The aminoglycosides, just as a side note, the aminoglycosides and the vancomycin will also affect what other organ? We know they're going to affect the hearing, but they're also nephrotoxic. And nephrotoxic means that there is damage to the kidneys, all right? And then you have magnesium silicate. That's going to also be an ototoxic agent. So really good stuff to know when you are thinking about, how do I study pharmacology? What's important for me to know about pharmacology? All right. So add this to the back of your quick facts. Everybody on this lecture needs to have quick facts, and a lot of this stuff is in quick facts, but I mean, how awesome would it be to just turn to your pharmacology section, right? Pharmacology section for NCLEX, and have these notes in there as well. All right, so I love this book, and I just hope you guys love it too, because it's tremendous for helping you really focus in on pharmacology for NCLEX. All right. Okay, so we're going to get into our pharmacology clinical case study. And what you have here is the full list of orders for the client we're going to discuss. Now, I know on your worksheet some of these are missing, so go ahead and write them in so that we can have a full understanding of what this patient has been ordered. You know, and just by looking at these orders, I'm able to kind of see what type of patient I'm going to have. And I hope that's the case for you all as well, where you can look at these medications and these treatments and kind of anticipate the type of diagnosis that this patient is going to have. So if we read about the healthcare provider's progress notes, we get a lot of information about who we're caring for. So it says at 9 a.m., Mary Jane, 64, had ingested an overdose of benzodiazepines with a large glass of wine. Because this was unknown when entering the emergency department, the client received several interventions to reverse the possible cause of the condition. All right, so this progress note is telling me that our client, Mary Jane, came in, she was intoxicated, unconscious, but they did not know the root cause. So when you're not sure why a patient could be unconscious, you have to be very aggressive. So they may have had to give her naloxone, Narcan. They may have said, okay, is this an opioid overdose? Is this a benzodiazepine overdose? Is this some other kind of inhalant or vapor overdose? Is this alcohol? And so here the progress note of the healthcare provider was saying, we didn't know what was causing the condition, so the client received several interventions. All right. So here is the question here. You guys know the patient now. Mary Jane was transferred to the medical surgical unit. Using the call light, she requests to see the registered nurse immediately. Upon arrival of the nurse, Mary Jane is pacing around the room, displaying symptoms of psychosis. Mary Jane admitted to using cocaine in the bathroom for an energy rush to get her through the day. Her current vital signs: heart rate 113, respirations 32, blood pressure 142/98, temperature 98.9. So here we go. All right, we know the situation. Mary Jane, she is using in the bathroom. She's pacing around the room, displaying symptoms of psychosis. These are her current vital signs. So after notifying the healthcare provider, which medication should the nurse anticipate to administer? And this is a select all that apply. So I want you guys to really use your clinical judgment here about what's going to be most appropriate. So here are the choices. They are: number 1, nicotine; 2, propranolol; 3, haloperidol; 4, diazepam; 5, caffeine. Now, we're talking about which medications should the nurse anticipate to administer. Now, this is just you giving your best educated guess about what can be used for this client at the time. So here are the choices again. I want you guys to try to think about it. What would be close, what would be most appropriate, what would be safest for the patient. And then I'm going to show you the answers. And remember, here when we're studying together, if you get it wrong, it's really not a big deal. What's most important is that you're learning and you're understanding from the rationale. All right, so the correct answer: which medication should the nurse anticipate to administer? Propranolol, haloperidol, and diazepam could all be treatment options for this patient. Now, nicotine is a stimulant. It's not going to be effective, and neither is caffeine. But you have a beta blocker. You have a first-generation antipsychotic, right? And you have a benzodiazepine here. So these medications could all treat this client's current condition. All right, so the nurse should anticipate to administer any one of these 3. Does that make sense? And if this question was really hard for you, it really could just be an issue that you're not really familiar with what those drugs did, all right, or how they worked. All right, so again, when you study for NCLEX, you have to understand that it's the content that's going to take you the furthest. And when I say the content, it's literally the facts, the knowledge about the information. The questions are great. You can do questions, but all they will show you is your weak areas. All right, so you're not really learning from them. Now it says, this is a case study, so we're following the patient. So it says, the following day, the unlicensed assistive personnel reported Mary Jane to be lethargic and unable to respond to verbal commands. The registered nurse obtained a capillary glucose reading of 48. She reported the finding to the healthcare provider. Which of the following orders would be the most effective intervention? Is it going to be 10% dextrose at 5 milliliters per hour? Would it be 3 glucose tablets, okay, 15 grams of glucose? Would it be glucagon IM, 1 milligram? Or would it be Ritodrin IV? Which of the following are going to be the most effective for your client who has a blood glucose level? Mary Jane has a blood glucose level of 48. Well, from the choices that we're given, this is pharmacology, this is you guys applying it, the correct answer is going to be number 3, the glucagon IM. Because this patient is lethargic, we do not want to give them anything orally at all. All right, and if we look at, so that eliminates number 2, okay? We don't want to give anything orally by mouth. 10% dextrose would raise the blood sugar, but not at this amount. That's 5 milliliters an hour, right? We need something that's going to work very fast because this patient could be slipping into a diabetic coma. And then the 4th medication is not appropriate. If you recognized it from Quick Facts, then you know this is a medication for premature contractions. All right, so pharmacology for NCLEX is easy if you understand the pathophysiology of the patient. Thinking about Mary Jane, her husband, Carl Jane, the husband of the client, comes for a visit. He tells the nurse that when Mary discusses her best friend's death, she uses more drugs. So which members of staff should be included on the interdisciplinary team? Select all that apply. Okay. So you guys know the patient, which members should be included on the interdisciplinary team? And I see the answers. Yes. Yep. I see the answers. Okay. And I'm going to reveal it to you. All right. I'm going to reveal it to you. But remember, we went over the interdisciplinary team. Remember, the focus of the interdisciplinary team is to keep the clients safe, help them to avoid any complications that may result from them being in the hospital. So the more complex the patient, the greater the need for a larger interdisciplinary team. All right. So here, the correct answer was 1, 2, 3, 5, and 6. Mary Jane had a few issues that she was dealing with. So first of all, she had a history of diabetes, right? Then she also had a suicide attempt, basically by doing the benzodiazepine and also doing the wine. And then we found out that her husband said that she also abuses cocaine. So her interdisciplinary team would have been very robust. So her interdisciplinary team members included the nurse. Well, you guys have 1, 2, 3, 5, and 6. Okay, so it included the nurse for sure, because the nurse is going to be the one who is going to be able to direct the medications being administered. The psychiatrist was needed because the psychiatrist was going to help Mary Jane with her emotional issues of her friend's death. And then the healthcare provider, of course. So let me show you guys now. All right. The healthcare provider is going to prescribe the medications to treat the condition, right? The dietitian was important because somebody with diabetes mellitus, they're always going to need counseling on how to have a healthy diet to control the blood glucose measures. And of course, the pharmacist is going to be there because this patient is going to have a lot of potential for medication interactions. All right. So yes, the pharmacists and the dietitians, they are part of the interdisciplinary team. I mean, that's why it's called multidisciplinary or interdisciplinary, because you have professionals from different expertise. Okay, let's do question number 4. Now, Mary Jane is now discharged home with a prescription for 444, a short-term anti-anxiety medication. She asked the nurse if she can take the anti-anxiety medication with 1 glass of red wine. What is the best response by the nurse to the client? So here, Mary Jane is essentially asking if she could take this medication with 1 glass of red wine. So here are the options. Number 1, the wine mixed with the medication will cause a dangerously high level of your blood glucose reading. You should not drink and drive. 2, the medication may be taken with 1 glass of wine, is safe, but no more than that. So the medication may be taken with 1 glass of wine, that's safe, but no more than that. 3 is combining the alcohol and medication could kill you as the mixture is lethal. 4 says, are you worried you will not be able to maintain your sobriety? Okay. So these are the 4 choices. What's going to be the best response by the nurse? And the best response by the nurse is clearly going to be, especially, you guys know Mary Jane's history. You guys know what she came in here for. So you can make the appropriate choice to say that it is going to be 3, combining the alcohol and medication could kill you as the mixture is lethal. Mary Jane already has an issue with overdosing by combining medications and alcohol. So you need to be very straightforward with her. If you say number 1, the wine mixed with alcohol will cause a dangerously high level of your blood glucose reading, that's not serious enough. All right? You should not drink and drive. No, that's not the point. We need Mary Jane to know that under no circumstances, number 2 says you can have it with 1 glass of wine. That's not going to be accurate. All right? Number 4 says, are you worried you will not be able to maintain your sobriety? Yes, that is a response that allows Mary Jane to talk and share more about her feelings. But for somebody who overdosed already, they need to understand you can't ever do this. All right? There's no leeway for this patient. Okay? Okay, so here it is. When you are studying, this is what it should look like. And this information comes from the virtual trainer in terms of digging into that content. So I wanted you guys to take a quick view for day number 3 on pharmacology and how you should be studying for this exam. Pharmacology is a tough subject, and it requires daily review, and it requires being able to have somebody to sit down and study with you. I am the study buddy that's always ready to study. I'm the instructor that's always ready to say, let's go, let's go. Let's get this. It's almost 2020. You guys need to take advantage of this offer. It is amazing. The new year, this is the perfect gift for yourself. The holidays is over. Let's get focused. NCLEX virtual trainer. This is it. Hey guys, I just wanted to let you know the fun is not over yet. That's right. This review is still going on. These are the things that you want to know before you take that test. I can't wait for you guys to study with me again. I can, I will, I must pass NCLEX. I can, I will, and I must pass NCLEX.
What's up, guys? We're back again. My name is Mark Callion. I am the president of REMAR Review. You can consider me the REMAR nurse chaplain, and I just have a question to ask you today. Who do you believe? Who do you believe? There's a story in the Bible in the book of Luke, chapter 1, verses 5 through 8. It starts off, it says, "There was in the days of Herod, the king of Judea, a certain priest named Zacharias, and of course of Abiah. And his wife was the daughter of Aaron, and her name was Elizabeth. And they were both righteous before God, walking in all the commandments and ordinances and of the Lord blameless. And they had no child because Elizabeth, she was barren. And they both were now well stricken in years, And it came to pass that while he executed the priest's office before God and in the order of his course, according to the custom of the priest's office, he was of the lot to burn incense when he went into the temple of the Lord. And the whole multitude of the people were praying without at the time of the incense, and there appeared unto him an angel of the Lord standing at the right side of the altar of incense. And Zacharias said unto the angel, Whereby shall I know this? Now listen, this is a very important part of the story. So Zacharias, he is a priest. He's the husband of Elizabeth, and they are both older, well-aged, but they don't have any children. And in that time, if you didn't have a children, it was something wrong, if you will. It was considered maybe an outcast or a little bit less than because you didn't have a child in that social structure. And so now here they are. Here Zacharias is. He's ministering in the temple, burning incense, while the people are praying outside. And it's amazing because he's inside ministering to the needs of the people, but he has his own needs. And God sees him in that. And God, what he does is he sends an angel by the altar to appear to Zacharias. And he gives him some very, very interesting and important information. Check it out. And so in verse 11, it says, And there appeared unto him an angel of the Lord standing at the right side of the altar. And the angel tells Zechariah this. He says that God has heard your prayers. And he knows that you want a child even though your wife is barren. And so the angel tells Zacharias this. He says, Your wife will conceive a son, and you shall name him John, because he will be a minister of God. And Zacharias, he hears this information. This is something that he's been praying about, but he was praying, but he wasn't believing. And so he asked this question. He asked the angel. He says, how? How is this even possible, being that I'm an old man and my wife is barren? How is it that I'm going to have a child? I just can't believe this. And so what I want to tell you is, when you get information from God, when God answers your prayer, when he tells you that the thing that you've been praying about can happen, you have to watch what you say next. When somebody tells you that the thing that you've been praying about, the thing that you're hoping for is going to come to pass, just be careful what you say next. This is what Zacharias said. He says, how is that going to happen? I don't believe it. I don't see how that could actually happen. And so God did something very, very merciful and graceful to protect Zacharias. And after the angel told Zacharias the good news that he and his wife Elizabeth were going to bear a son, this is what Zacharias said to the angel. And Zacharias said unto the angel, Whereby shall I know this? For I am an old man, and my wife is well stricken in years. And the angel answering said unto him, I am Gabriel, that stand in the presence of God, and I am sent to speak unto you, and to show you these glad tidings. And behold, thou shalt be dumb, and not able to speak, until the day that these things shall be performed, because thou believest not my words, which shall be fulfilled in the season. And so because Zacharias did not believe the word of God, he did not believe the message that was sent to him through Gabriel, that the blessings, that the thing that he was asking for, the thing that he and his wife were both praying about would come to pass, the angel says this. He says, listen, because you did not believe, I'm going to make you dumb. In other words, I'm going to silence your mouth so that you cannot speak until these things come to pass. And there's a very important lesson in that. So sometimes God, he wants to bless you more than you understand. God wants to give you more than what you're actually asking for, but you have to believe. And when that blessing is pronounced over your life, when that thing that you've been praying about is set to come to pass, it's very important how you speak. And so what God did for Zechariah, he says, I don't want you to ruin your own blessing, so I'm going to make you dumb. I'm going to take the words of negativity out of your mouth. I'm going to cancel you from being able to speak that doubt over your own life. And what I want to do is encourage you as a Remar nurse is that you can, you will, and you must pass NCLEX. it's going to happen for you. You're going to get the content, you're going to put in the work, you're going to put in the focus, you're going to put in the dedication, and any thought that you're thinking that goes contrary to that, we pronounce it dumb. Close your mouth. Don't say anything else unless it's I can, I will, I must pass NCLEX. Remember, you can do this because with God, it's possible.
Hi Remar family, good morning, good afternoon to everyone. I'm here to give a comparison between the self-study DVD package and the virtual trainer, but before that, let me introduce myself. I'm Charmy. I graduated 2006 way back in the Philippines. I purchased the DVD self-study package during the Black Friday because I have seen a lot of nurses passing the NCLEX exam using the DVD self-study package. And the 5-star quick facts, it has a lot of information that I needed for the NCLEX exam. For me, the DVD self-study package has a very good content already for studying the NCLEX exam, but since some information are not yet updated, what I did is I tried to search for it in the internet or read the book so that I can have a thorough understanding of the topic. The NCLEX Virtual Trainer is a new way for nurses to study the NCLEX exam. It is very informative and interactive way of studying. And then since the books is not yet here, I tried to do the before the books arrive activities, which is mostly the fundamental of nursing. It is a fun way to study because this will help you remember the fundamental of nursing. And because my book is not yet here, so I tried to start the NCLEX RN Virtual Trainer to see and to look what's the difference between the DVD and the VT. And the VT is very, very awesome. As I started the NCLEX RN Virtual Trainer without my book, I tried to open the DVD student workbook and compare it. So in the virtual trainer, there's a lot of information that Miss Regina added, and this information will help us a lot in passing the NCLEX exam. Yes, I purchased both of them because I want to give 110% for passing the NCLEX exam. So guys, if you are still in doubt of purchasing the virtual trainer, please do purchase so that you can give the best and you can invest the best for your future. God bless everyone. I hope we can and we must pass the NCLEX in Jesus' name.
Hi guys, good morning. So I purchased the virtual trainer this week. So far I've done a little bit of it and I like it already because it tracks your progress. It lets you know every time you log in. When you take a quiz, it gives you the score. And I have the DVD package as well, but I like the virtual trainer better because it tells you everything you need to do and it lets you know your progress.
My name is Regina, MSN RN, and I've dedicated the last 10 years of my life to helping students overcome anxiety, pass NCLEX, and get their nursing license. There is a way to study for NCLEX by focusing on the content, and I'm going to show you how it's done. Go ahead and get out your downloadable workbook so we can take notes. All of the information today is coming from our NCLEX virtual trainer. That's right, you're going to see this amazing program and how beneficial it is to help you get your nursing license. The NCLEX Virtual Trainer, this is the best resource I've ever created for nursing students to pass their exam. All of the REMAR nurses are in it right now. They're loving it, and I want you to have it too. We cut the price to just $150, so you didn't have any excuse why you couldn't get this amazing resource. 2020 is coming up. I want you to have your license. I created this amazing product so you can take control of your learning experience. Let's make NCLEX preparation easy. Get the virtual trainer. We have it while supplies last. It's just $150. I'm so excited for you to get your license this year. 7 days at NCLEX is all about preparing you to experience that big day. Do you know what that day is? I just want you to picture it. You get a white envelope. It says State Board of Nursing on the outside of it. You open it up and there it is, your nursing license. Everything that you've worked so hard for, every hour that you've spent studying, every dime that you've spent investing into your education, now here is the reward. And the reward is not only for you, but your family, your mother, your father, your children. They get to experience the benefits of you having your nursing license. And now it's just not about Christmas time. You can give gifts to yourself, to your loved ones all year round, because now, once you get your nursing license, it opens up so many doors of opportunity. But there's a process and there's a journey. I'm asking you, go on a 6-week journey with me and let me show you exactly what I've shown students for the last 10 years to help them to pass their NCLEX exam. I'm so excited for you, and congratulations for taking this step. We are going to get into some psychological concepts for your NCLEX. I'm going to make this as painless as possible. We got to talk about the conditions and also the medications that are most important for the exam. I want to compare two different illnesses that sometimes get confused, even with experienced nurses. We're going to look at the difference between delirium and dementia. Let's start with delirium. Delirium is an acute mental change that is reversible with treatment. This is a major point to realize. Now, there are many causes of delirium, but I have the acronym SIDE here. The S stands for substance abuse. The I stands for infection. Usually, a urinary tract infection is very common in the elderly. D stands for drug abuse, and E stands for electrolyte imbalance. Sometimes when our electrolytes are out of sorts or irregular, it can cause us to have some mental confusion. Now, on an assessment note, clients who are delirious will also have a decreased level of consciousness. Here is a memory impairment note. The delirious client will have a decreased short-term memory, which also allows it to be confused with other disease processes. The treatment for delirium is to actually find out what's causing it and then treat that, because once you treat the cause, the delirium will go away. And again, the research shows that even very experienced nurses confuse delirium with the next condition that we're going to talk about, which is dementia, because both are seen in the elderly. But when we think about dementia, dementia is a chronic, progressive mental change that has no cure. This disease also affects personality, judgment, and behavior. The most common form of dementia is Alzheimer's disease. Okay, let's critically think REMAR nurses. Is Alzheimer's disease considered a mental illness? Would you say yes or no? The correct answer is no. Even though some personality changes occur, it is not considered a mental illness. I want you to know the A's of Alzheimer's disease. You can also find these in your Quick Facts for NCLEX book. The first A is agnosia. Agnosia is an inability to use an object correctly. So this is where you may have your client using their toothbrush to brush their hair, right? The next A is alexia. It's an inability to read. Also, there is aphasia, which is an inability to communicate. And then there is apraxia, which means that this patient will have movement complications. You know, I always get emails from students to say, hey, Regina, can you tell me what are the signs of early Alzheimer's, middle, late? I need to know them for NCLEX. So I'm going to give you guys a quick rundown of what they are. So for mild or early Alzheimer's, the signs are forgetfulness. Also, confabulation. Confabulation is basically fake memories. The patient cannot remember what actually happened, so they make up a story so they can tell how they felt in that period of time. Another early sign of Alzheimer's is a decreased personal hygiene. For NCLEX, the middle or moderate signs are all of the A's. If a patient is experiencing any of the A's, consider it a middle sign of Alzheimer's. And then the severe or late signs are sleep deprivation, incontinence of bowel and bladder. The patient has immunocompromised symptoms because they're not taking care of themselves. They're unable to. They're not eating properly. They're dehydrated. And also you're going to have further decline into the cognitive and psychomotor coordinations. The treatment for Alzheimer's disease is safety and reorientation. These should be provided by the nurse. You should let the client know if they're confused, where they are, what time of day it is. These things will help. Now, when reorientation is not appropriate, then redirection is the next action. So I want you guys to know about reorientation and redirection. Reorientation is telling the patient the correct time of day, the correct place, the correct situation. If a patient has Alzheimer's disease or dementia and they cannot understand reality, then the next step is to redirect them. That means turn their attention to something else. So if a patient is standing by the window and they're waiting for their grandmother to come get them, you may know that the grandmother is not coming, but they're not able to understand that. So we say, you know what? Why don't we draw a picture until your grandmother comes? Or why don't you come in your room and read a book with me until your grandmother comes? So that's redirecting their attention so that you can get them to the next destination. All right, let's move on. Since you guys know the difference now between delirium and dementia, I want to move on to two other conditions, which are depression and mania. Now, remember, unlike dementia, these clients are oriented to reality. That means whether you're depressed or manic, you know the situation, you know what time of day it is, you know who you are. So when we look at depression and mania, understand that very key point. But with depression, the signs are extreme sadness. So all the signs are considered negative. And negative signs mean that something is actually taken away from a normal personality. So a negative sign for depression would be sad. The patient is empty. They have no pleasure in anything. They are lethargic. They are crying. You see how these signs are all negative? They're not eating. So they're losing weight, right? They have suicidal thoughts. These are all negative signs. If we look at mania, there is extreme elation. They are happy, they're energetic. So all of the signs are positive, right? All of the signs are positive. So again, they're energetic. Write these down. They are impulsive. They're easily distracted. They're pleasure seeking. Right? Sometimes they may see more than what is really there. They may think they have more money in the bank account than they do. You know, they'll think they're more popular than they are. They think they're better looking than they are. So these are signs that you see that are all positive that represent mania. Now, the similarities between the two are these three things. And you can put this down in both boxes. But both conditions will have fatigue, memory loss, and mood swings. Fatigue, memory loss, and mood swings. Let's look at the treatments. The conditions are also the same. They are going to be mood stabilizers, counseling, lithium. Yep, lithium is a treatment, and antipsychotics if necessary. If we look at specifically depression, there's a laboratory test that NCLEX may ask you about, and it will be the serotonin level. The serotonin level will indicate if a client has low levels to result in depression. Okay? There isn't one for, say, for mania, but for depression, serotonin levels can be asked about. Remember, don't give these patients choices about their counseling. They definitely should go. All right, so based off of what you know about depression and mania, let's look at some symptoms or characteristics, and I want you to decide whether it is a symptom of depression or mania. So, number one, difficulty accepting compliments. Which one do you think that is? Yes, that's depression. Patients with depressions have low self-esteem, so they will not be able to accept a compliment. What about a bizarre dress? That is going to be mania. Absolutely. Number three, euphoria. Do you think that is a sign of depression or mania? Again, yes, that's mania. 4 is fear. 4 is fear. Fear, yes, this will definitely be depression. And the last one is impulsiveness. Impulsiveness. What do you think? Impulsiveness can actually be seen with both depression and mania. So that was like a trick question. All right, our NCLEX safety point, depression. Clients who are depressed are at risk for suicide, okay? So the nursing intervention to assess for that is you want to watch for sudden happiness. If a depressed patient is suddenly happy, that may mean that they have finally made a decision to try to commit suicide. Mania, our safety point, is we have to be careful because patients who are manic are defensive against authority. So if they view you as an authority figure, they may have a difficult time taking instructions from you. Before we close depression and mania, I want to tell you this. If a patient has both depression and mania together, it is called bipolar disorder. I don't want you guys to confuse it with my next subject, which is schizophrenia. Schizophrenia is totally different from bipolar disorder. If a patient has schizophrenia, they can't tell the difference between real and unreal. The disease is chronic and requires lifelong treatment. Now, because the schizophrenic client is not in sync with reality, they will have psychotic symptoms. And I have a list here of positive psychotic symptoms. And positive just means that they are adding to a normal reality. That's all it means. They're adding to a normal reality. So we have here delusions, hallucinations, neologisms, echolalia, and flight of idea. Let me ask you this. What is the difference between a delusion and a hallucination? A delusion is a false belief that something is true, where a hallucination is a false sensory belief. So a delusion is something that is not true, a false thought in the mind. Like, I am the president of the United States. That is a delusion. A hallucination involves the senses. So there is a sensory component, like I feel spiders touching me, or I taste blood every time I drink anything, because it's involving the sense of taste, the sense of feeling, the sense of touch. Or if patients say, I hear voices, that is a hallucination because it involves the senses. So remember the difference between those two. Neologism is making up new words, Echolalia is constantly repeating something that they've heard. And flight of idea is jumping from one topic to another topic during conversation. Now, you know, the negative signs of schizophrenia are listed there for you. The patient is mute, so they stop talking. They're catatonic, they stop moving. They're suicidal, they want to harm themselves, or they're homicidal, they want to harm somebody else. So a negative sign just means that something is taken away from a normal personality or normal behavior. The treatment for the schizophrenic patient is, if it's done medically, it's to put that patient on an antipsychotic medication. And don't worry, we will go over those medications for you. The environmental treatment is based on the nurse's behavior. Number one, we should use clear, direct statements. 2, we should sit in silence. 3, we should set limits on their behavior. 4, our nursing care here. Always keep in mind, experience to the client is real. Second, and these are just things of how we use therapeutic communication. We need to, number 2, acknowledge their feelings. 3, present reality. 4, set boundaries. And 5, avoid changing the subject. Okay, we are going to get into the medications when we come back, but you have a lot to study so far, so make sure that you stop and you review the notes before moving on. We're going to look at one of the easiest subjects to understand for NCLEX. That's right, I said the easiest. This is blood gas interpretation. We're going to look at it by numbers and also interpreting blood gases by diagnosis. It's going to be very cool. There are 2 values that you need to know when we're looking at blood gas interpretation by numbers. So there's only 2 that I will have you to memorize, and they are the pH and the bicarb. Now, let's just look at the pH column. The pH, of course, is the level of acidity in our patients. Can you tell me the normal range of a human being when it comes to their pH. Everybody should be writing down 7.35 to 7.45. Now, that's fantastic. That is the normal range. Let's look at some abnormals. If a person is below 7.35, then what do we consider that as? We consider that as an acidosis state, right? Below 7.35 is acidosis. Now, if a patient is above 7.45, then we say that's what? That is alkalosis. Very good. So the first number we already know, 7.35 to 7.45 range. Now let's go over to the bicarb. Can you think of what is the normal range of bicarb? And bicarb just means the level of bicarbonate or base that a person has in their blood. But the range is, I'll tell you, it is 22 to 26. So now that we have the two numbers that we're looking for, what do we do with them? Well, once you have the two numbers, I want you to think of Rome. Rome. And Rome stands for respiratory opposite, metabolic equal. And when I say opposite and equal, I'm actually talking about the directions that the numbers are going in. But I'm not going to explain it. It's just easier to have you to do it. So let's look at our first question here. If we have a pH of 7.53, a PaCO2 of 33, a bicarb of 33, and a PaO2 of 72, all I want you to do is I just want you to focus on the pH and the bicarb number. So go ahead and circle those numbers, the pH number and the bicarb number. That is all we care about. So underneath the question, I have the pH of 7.53. Is this going up or down on our normal range? And remember, our normal range was 7.35 to 7.45. So here at 7.53, is this going up or down? Yes, this is going up. So draw an arrow going up. Now, let's look at the bicarb number, which was 33. Is this going up or down? What do you think? This is also going up. So now that we have our two numbers, we can look at Rome. Rome means respiratory opposite, metabolic equal. So are these two numbers going in an opposite direction or an equal direction? These two numbers are going in an equal direction. So is this a respiratory problem or a metabolic problem? What do you say? Absolutely, this is a metabolic problem. So the first part of our answer is metabolic. Now we have to determine, is this metabolic acidosis or metabolic alkalosis? And the way we do that is simply just looking at one of the numbers. Which number do we look at now to determine acidosis or alkalosis? We look at the pH. So looking at the pH, is our patient in metabolic acidosis or metabolic alkalosis? Because that pH is 7.53, our patient is in an alkalosis state. So your final answer is metabolic alkalosis. So now that you know how to do ABGs using the Rome method, I want you to try to do the other two on your own. Hit the pause on this video, and when you come back, we will go over the final two. Okay, let's get started by looking at problem B. It says, how would you interpret this blood gas? The pH is 7.10, the PaCO2 is 24, the bicarb is 45, the base excess is 3. All you have to do is focus on that pH and that bicarb number. So our pH, 7.10, is that up or down? That's down on the normal range. The bicarb of 45, is that higher or lower than normal? That's absolutely higher. So Are the pH and the bicarb going in an opposite direction or an equal direction? These are opposites, so we know that this is a respiratory problem. Now, let's look at the pH so we can determine if it's alkalosis or acidosis. The pH is 7.10. That's down from the normal range. So this is respiratory acidosis. I hope you guys have gotten this right and you're ready to move on to the next one. Problem C says, how would you interpret this blood gas? The pH is 7.32. The PaCO2 is 35. The bicarb is 17. And the PaO2 is 89. So we have a pH of 7.32. That is going to be down. The bicarb 17 is also down or lower than normal. So these two numbers are going in an equal direction. This is a metabolic condition. Now let's look at the pH and we can determine that this is metabolic acidosis. All right, now you guys are able to do any blood gas interpretation by number that NCLEX will give you. Now I get a common question is, what if one of the numbers are in a normal range? Well, if one of the numbers are in a normal range, then it can be a compensated or a partially compensated blood gas interpretation. For entry-level nurses who are taking the NCLEX, you do not need to know about partially compensated or uncompensated blood gas interpretations. Let's stick to the basics and we will get every question right. Now, we learned the Rome method using numbers, but there is also another way to interpret blood gases, and that is by diagnosis. We can't use Rome, so I'm going to show you a better way to do blood gas interpretations by diagnosis. You have to start by asking yourself a question. If you're given a diagnosis, the first question that you ask yourself, write this down, is it a breathing problem? Is it a breathing problem? And there can only be two options, that is yes or no. So let's just focus on yes right now. If we asked ourselves, is this a breathing problem? And the answer is yes, then we know the first part of the answer is respiratory. So write respiratory in the box underneath yes. But we still have to determine if it is respiratory alkalosis or respiratory acidosis. So here is our clues. Alkalosis equals breathing too fast. Acidosis equals breathing too slow. So that's how we determine respiratory alkalosis or acidosis. Now, let's go back up to the top to the very first question we asked ourselves, is this a breathing problem? Now, what if the answer is no? If it's not a breathing problem, if it's not respiratory, then what is it? Then no equals metabolic. No equals metabolic. So now we have to determine, is it metabolic alkalosis or metabolic acidosis? So alkalosis equals vomit or suction. If you see that anywhere in the problem, you know that this is metabolic alkalosis. Acidosis equals everything else. Acidosis equals everything else. So now that you have the content, let's put it to action in some questions. We're going to do the first one together. It says, which blood gas would you expect to see in a client with a pulmonary embolus? So we have the diagnosis of what? A pulmonary embolus. Let's use our chart. The first question that we asked ourselves is this a breathing problem? Pulmonary embolus? Yes, absolutely. So we know the first part of our answer is respiratory. Now, let's determine if it's respiratory alkalosis or respiratory acidosis. A client with a pulmonary embolus, are they going to be breathing too fast or breathing too slow? They will be breathing too fast. So here we have respiratory alkalosis. Do you see how easy that was now? I want you to try the other ones by yourself and come back to the video when you're ready to review them with me. Okay, let's go on to number 2. Which blood gas value would you expect to see in a client who has diabetes mellitus type 2? Now, this would be tricky if we didn't have the steps to do it. So now that we do, we can ask ourselves, diabetes mellitus type 2, is this a respiratory condition? No, this is metabolic. Now, do we see vomit or suction anywhere in the problem? Nope. So this is metabolic acidosis. Number 3, which blood gas value would you expect to see in a client who has chronic obstructive pulmonary disorder or COPD? Asking ourselves that first question, is this a respiratory problem? Yes. How do clients with COPD breathe? Are they breathing too fast or breathing too slow? They're normally breathing too slow, not having the same kind of gas exchange as a normal person. So this is respiratory acidosis. Number 4, which blood gas value would you expect to see in a client who has a pancreatic fistula and diarrhea? Is this a respiratory problem? This is metabolic. Now, do we see vomit or suction? No, we don't. This is metabolic acidosis. Are you doing great? I hope you're feeling so good about these blood gas interpretations by diagnosis. Last one, number 5. Which blood gas value would you expect to see in a client 26 weeks pregnant with hyperemesis gravidarum? The correct answer is metabolic alkalosis. We do see vomiting with that condition. So this is metabolic alkalosis. And again, for NCLEX, you don't have to worry about compensated or partially compensated blood gas interpretations. All right, congratulations. You guys are now experts on ABGs.
Welcome to the 7 Days of NCLEX. My name is Regina, MSN RN, and I've dedicated the last 10 years of my life to helping students overcome anxiety, pass NCLEX, and get their nursing license. There is a way to study for NCLEX by focusing on the content, and I'm going to show you how it's done. Go ahead and get out your downloadable workbook so we can take notes. All of the information today is coming from our NCLEX virtual trainer. That's right, you're gonna see this amazing program and how beneficial it is to help you get your nursing license. 2020 is coming up. I want you to have your license. I created this amazing product so you can take control of your learning experience. Let's make NCLEX preparation easy. Get the virtual trainer. We have it while supplies last. It's just $150. I'm so excited for you to get your license this year. Oh, it's going to be an exciting class. Let's get started right away. I'm so happy that during the 7 days of NCLEX, I can share part of my nursing journey with you. You know, I was raised by a single mom who was working 2 jobs while taking care of myself and my brother. In high school, we had no one to take care of my grandparents when they got sick. And so at 16 years old, I was given the opportunity to provide care for my grandparents. And it was actually a home health nurse named Linda who saw me, a 16-year-old cheerleader, and said, you can provide nursing care to the people that you love. And she literally poured in her knowledge to me and made me feel so confident and gave me the confidence to care for the people that I love. And so now it is my turn to give back to nursing students who want to learn, who want to get their nursing license. And because of where I came from, I know that you can learn this material. I believe that you can learn this material. I believe it doesn't have to be hard or difficult to study for NCLEX. You don't have to be confused. You don't have to be afraid of the test. If I learned the nursing information and passed NCLEX, you can do it too. So during the 7 days, we are going to make sure that you understand the important topics of NCLEX so that you pass and get your license. Total parenteral nutrition. Let's get into it. With TPN, this is actually a method of feeding that bypasses the gastrointestinal tract. So the way that we feed this client, we don't involve the stomach, the intestines, any of that, because we're using a special formula. So some may ask, Regina, how is this done? Well, what are the nutrients going through? They're going through the veins. They're actually going through the veins. So when nutrition goes through the veins, whose job is it to process that nutrition? What organ is now responsible for providing nutrition, right? You guys know it is the liver. So the liver metabolizes the formula, and then the body is able to receive it that way. So this is a very complex intervention. It is not given to everyone. Who needs TPN? The client whose GI tract is not functioning correctly. They need TPN. So these are clients that have issues with their bowels or their stomach. So for example, ulcerative colitis patients, patients with Crohn's disease, right? Where they need a real intervention in order to prevent malnutrition, because that's the goal of TPN. We don't want our patients to become malnourished, so we have to feed them this way. Now, NCLEX may give you a scenario where you have a pregnant woman and she's really nauseated, she's vomiting all the time, and they will ask, is TPN a good solution for this patient? What is your answer? No, absolutely not, because the condition is pregnancy. There's nothing wrong with the gastrointestinal tract. NCLEX may give you another example where they say you have a client and they have stage 4 cancer, they're getting chemotherapy, they're terminal, the cancer's in the lungs, the chemotherapy is causing them to be nauseated, they have ulcers all around their mouth. Do they need TPN? What's the answer? The answer is no, these patients don't need TPN. There's other ways we can feed a client if they're nauseated, if they have ulcers. We can put down an NG tube, right? And still use that gastrointestinal tract because it's normal. So the reason why we don't want to give TPN is because when the liver begins to metabolize food, it causes a great strain on the liver, and your client will start to experience some liver failure within a few weeks. So this is something that's reserved for severe cases. When you're given TPN, what labs do you want to monitor? Well, you want to monitor the blood glucose levels, because TPN is mostly made of what substance? It's mostly made of dextrose. And dextrose, a lot of glucose. It's all sugar. So what is it going to do to the blood glucose levels? Is it going to raise or lower them? It's going to absolutely raise the blood glucose levels. So clients on TPN have their blood sugar monitored every 4 to 6 hours. You're going to go around and check it. What electrolyte imbalances can TPN cause? These are the ones that I want you to know. Hyperkalemia, hypermagnesemia, and hyperphosphatemia. And this usually happens in the beginning because normally TPN has nutrition and electrolytes inside the formula. And so the body has to adjust to receiving nutrition in this way. Oh, if your TPN runs out, what is the emergency substitute for TPN? That is 10% dextrose. Yes, you never want to abruptly stop TPN. You always want to gradually taper it off. TPN should always be given on a pump, and 10% dextrose is your emergency substitute. I hope you guys feel a lot better about this topic of TPN. I hope you know who you can give it to, who you can't give it to. What is your emergency substitute? And how do we wean a patient off of TPN? We do it gradually. You are ready to move on to the next subject. Hey guys, we are going to get started with your maternal and child overview by talking about the pregnancy lecture. Let's get started by knowing that the hormone responsible for pregnancy is the HCG hormone. I have that written down for you, so now you only have to take notes of the things that I'm continuing to say. We are going to look at the probable versus positive signs of pregnancy. You have to know this for NCLEX. So there are 3 probable signs that I want you to be familiar with. The first one is Hagar's sign. Do you know what Hagar's sign is? It is a softening of the uterus. Number 2 is Goodell's sign. Sometimes people get Goodell's sign confused with Hagar's, but Goodell's is actually a softening of the cervix. And the third sign is called Chadwick's sign. This is where you will see a bluish discoloration of the vagina and cervix. The fourth probable sign of pregnancy is actually 2 things. The first is all blood tests and all urine tests. That's right, a woman can be looking at a positive urine home pregnancy test and still not be pregnant. Can you think of why a woman would have a positive urine home pregnancy test but not be pregnant? The body can actually interpret tumors in the uterus to be pregnancies or other things that are not babies. So all blood and urine tests are always considered just probable signs. Now, our positive signs of pregnancy, they're more definitive, where you can actually see that a baby is growing inside of a woman. So, for example, you have your Doppler ultrasound, a fetal x-ray, or a fetoscope. Now, we need to go over Nagel's rule because this will give us the estimated delivery date for that baby. Now, in order to do this very important rule, you will need to know the last date of the menstrual period. Now, NCLEX will give you that date, so all you need to do is plug in our formula, which is to add 7 days, subtract 3 months, and then add 1 year. So let's give it a try. If the last menstrual period was May 5th, 2018, when is that estimated delivery date? Do you have it? The correct answer is February 12th, 2019. And you know what? Sometimes to make it easier on myself, I will turn the month into a number and subtract 3 from that number. So for example, May is represented by the number 5. So I would subtract 3 from 5 to get 2, and I know the month that goes along with number 2 is February, and then I would just proceed from there. That's my easy trick to do Nagel's rule. All right, next let's talk about monthly doctor's visits. You want to know this schedule, so I'm going to break it down into 3 categories, and then I'll also tell you important milestone markers for the fetus during those months. So up to 28 weeks, the mom is going monthly for doctor's visits. And at 16 weeks, lanugo is formed on the baby, which, if you aren't familiar with lanugo, it is the fine baby hairs that will cover the entire body. 28 to 36 weeks, you have bi-weekly doctor's visits. So every 2 weeks, a mom is going to the doctor's. Did you know at 28 weeks, the alveoli begin to develop and surfactant is actually produced in the fetus's lungs? Surfactant is so important because it allows for lung expansion to take place. 36 to 42 weeks, a woman is going every week to see the doctor. So there will be weekly doctor's visits. And at 36 weeks, there is rapid fat production in that fetus. Another term I want you to know is called lightening. And lightening is when the fetal head drops down into the pelvis so that the baby can enter into its final birthing position. These are your monthly doctor visits. Let's move on to 2 very important terms that you want to make sure you know the difference between before taking your NCLEX exam. They are gravity and parity. Yes, know the difference between these 2. Gravity, number 1, it is the number of pregnancies that a woman has had, even if that baby was not born. So that includes any abortions, any miscarriages. Whereas parity is the number of pregnancies that have been carried to term, right? Meaning that the baby is able to live on its own. Now, what I want to ask you is this. If a woman has 4 children, 2 single children, and a set of twins, what is her parity? Is it 3 or is it 4? What do you think? Yes, the correct answer is going to be 3. Because remember, even though a woman was pregnant with twins, her pregnancy is still just counted as one pregnancy journey. So if she has 2 singles and a set of twins, then her parity is 3. Let's go over some diagnostic procedures that are important to know during pregnancy. As a registered nurse, you definitely want to know about the amniocentesis. Yes, an amniocentesis is done for 2 reasons. The first one is you want to know about the fetal lung maturity. The second is that you want to know the overall well-being of the baby. Let's look at the administration and then some client education points. The amniocentesis is normally done at 16 to 20 weeks, and it's only done if a woman meets certain criteria. So this is not a procedure for every pregnant mother. And the reason is because it is an invasive procedure, meaning that with an amniocentesis, there will be a needle insertion into the abdomen. Our client teaching points are 4 of them that I want you to know. Number 1, a written consent is needed for this procedure. The second is that the woman must empty her bladder before the procedure is done. You guys know that a full bladder can actually misplace the uterus, which you don't want during this procedure. Everything has to be very precise to make sure that that needle gets into the right location. So our third teaching point for registered nurses is that an ultrasound will be done to locate the uterus and the placenta of the baby. Number 4, vital signs and fetal heart rate are monitored during this procedure. During the amniocentesis, you want to watch for premature rupture of membranes, also decreased fetal movement, and third, infection. Oh, our next diagnostic procedure is all about the Rh immune globulin. Now, the Rh immune globulin is given when, this is the indication for it, this is given when the mother is Rh negative and the baby is Rh positive. Now remember, the immune globulin is a protein that is found on the blood. Let's go over the administration. The Rh immune globulin is given to the mother, okay? Always given to the mother. Do we ever give the Rh immune globulin to the baby? What do you guys think? No, never. Never give it to the baby or never give it to the father. Now, when do we give it? It can be given 2 times, at 28 weeks and within 72 hours after the delivery of the baby. The client education has to do with the exam or the test called the indirect Coombs test. Now, this is used to determine the presence of antibodies in the mother. The client education has to do with the indirect Coombs test. The indirect Coombs test is for the mom to determine if she has antibodies. The results should be negative. The client education has to do with the indirect Coombs test. A negative indirect Coombs test means that the mother has not developed antibodies against her Rh positive baby. Okay? So we want the test to be negative. And if the exam is negative, then that requires us to give the mom the Rh immune globulin RhoGAM or Rh immune globulin. All right? Another name for the Rh immune globulin is RhoGAM, but for NCLEX, we have to stay away from the brand names. Again, this is given 28 weeks during the pregnancy and 72 hours after delivery. Some people say, hey Regina, how do you give the Rh immune globulin? It's actually given as an IM injection. So if it's given properly, it should not cause that much pain. Now, the last diagnostic procedure that I want to talk about is the non-stress test. There are 3 reasons why a non-stress test is performed. Number 1 is the baby's heart rate is irregular. So maybe it is running a little bit low or it's staying the same and there's very little variation. The second is decreased oxygenation. And the third is fetal well-being. The administration points are typically a non-stress test is done after 28 weeks. And what happens are the counts of the fetal movement are measured. So for about 20 to 30 minutes, you're recording the amount of times the baby moves. You're also looking at the heart rate. There are 2 results for the non-stress test. Either it's reactive or non-reactive. So I want you guys to know that reactive is a negative. And negative is a good thing. It's normal. It means the baby's heart rate is accelerating at a normal pace. Now, a non-reactive non-stress test means the baby was abnormal. There was inactivity. The baby wasn't moving during that time in the way that it should be. So, our client education is to tell the mom that she should eat and drink before the exam. Eating and drinking actually encourages the baby to move. I don't know if you guys knew that. So NCLEX might try to trip you up and say, or ask you, I would say, should the mom be NPO before a non-stress test? And that answer is going to be no, she should eat. The non-stress test is also non-invasive, meaning that there is no risk to the baby or the mother before it's done. We're going to look at 6 points. Let's start with morning sickness. Did you know that morning sickness was actually due to hypoglycemia? That's right, the blood sugar drops, and so just like with our diabetic patients, the pregnant mom will feel nauseated. She will feel weak. She will feel sick. So what do you think we tell pregnant moms who have a low blood sugar? What do we tell them to do? Pregnant moms who have morning sickness, result of a low blood sugar, we tell them to eat dry carbohydrates. That's right, just like our diabetic patients, we tell them to go ahead and eat dry carbohydrates. Also, to sit up after meals. When it comes to backache, it is such a common concern for pregnant moms. We tell them to use good posture and avoid spine curving. We tell them not to curve their spine inward. Also, they should use the pelvic rocking technique. Number 3 is leg cramps. To prevent or reduce leg cramps, we tell the mom to dorsiflex the foot. The diet for a pregnant mom should always be high protein with a prenatal vitamin. 5. Anemia is normal during pregnancy. And if you think about it, it's simply because there are more red blood cells required to grow the fetus. Kegel exercises are number 6, and they are used to strengthen the pelvic floor muscles. This is so important for men and for women. Yep, that's right. Men can also do Kegel exercises, but women, particularly during pregnancy, need to do Kegel exercises in order to prevent urinary incontinence.
This is what it should look like. And this information comes from the virtual trainer in terms of digging into that content. And it requires daily review, and it requires being able to have somebody to sit down and study with you. I am the study buddy that's always ready to study. I'm the instructor that's always ready to say, let's go, let's go. You guys need to take advantage of this offer. It is amazing. The new year, this is the perfect gift for yourself. The holidays is over. Let's get focused. NCLEX virtual trainer. This is it. The fun is not over yet. That's right. This review is still going on. These are the things that you want to know before you take that test. I can't wait for you guys to study with me again. I can, I will, I must pass NCLEX. I can, I will, and I must pass NCLEX.
Hello, my name is Kiki. I am a medical assistant, but I took my LPN. I'm an LPN graduate, and I graduated in 2016. I was then diagnosed with cancer, so when I walked across the stage, I knew I had breast cancer, but I was determined to take my exam, so I took it and I failed it. And then I studied and I took it again and I failed it, and then one more time. So I failed it 3 times. I didn't think about doing it during chemo. I don't know what's wrong with me. But I am back in the game. That was in 2016. It's 2019 right now. And to be honest with you, if it wasn't for REMAR Review and the DVD program and the website for the VT, I would not be able to pass my exam. I'm going again as soon as I'm done with this testing. So I am looking right now at the virtual trainer, and I want to just show you. I know it's probably backwards. I don't know if I can do it, but I'll show you this way then. Before the books arrive, it says, okay, for PN. So you get to do things on the website to get familiar, but also to take care of some things before the books arrived. And to be honest with you, I would not even I don't know what I would have done if it wasn't for Remar Review. For Mark and Regina, thank you so much for making this fantastic program. It teaches the way I learn. I have the Quick Facts and the Quick Facts DVD, which I absolutely love. I also have the DVD program that I am just finishing up. I just got your virtual trainer on Black Friday, and I'm so excited to get to it. So immediately, even while I was sick, I'm actually sick right now. I was sick for 2 days, and I jumped onto the VT just to get familiar and to just start doing it. And I can't tell you, if you guys are debating, if anybody's watching this video and wondering if they should do this, trust me, trust me, you should do this. I had the DVD program, and I'm still doing VT. They lowered the price for Black Friday. I jumped on it, absolutely jumped on it. But I've got my books and my program, and I am good to go. So I'm really excited to say that I am going to be a Remar nurse. I am going to be a Remar nurse. So I am excited to get the books. They should come today. And if they don't, that's okay too, because I still have the website to look through and to enjoy and to get familiar with, because there's areas of my favorites and the document server that you can get your downloads from. And it's called the, I looked at it has a report card. It's fantastic. Why wouldn't you do this? It has the my notes, my assignments, my courses. It's got everything right at the fingertips right here. Here is what I'm looking for. This one is the folders and categories where you can download. Anyway, there's a downloadable thing where you could download paperwork, the schedules for each week and everything else. Guys, do it. Get off the computer. Go order it right now. They are waiting for your call. They're open till 4:30. I'm telling you right now, if it wasn't for Remar, I wouldn't be able to do it, I don't think. I have every other study program. My whole class had it. Most of them passed. But I had my issue. But honestly, do it. Don't wait another second. Get off the computer. Go check it out right now. Bye.
Welcome to the 7 Days of NCLEX. My name is Regina, MSN RN, and I've dedicated the last 10 years of my life to helping students overcome anxiety, pass NCLEX, and get their nursing license. There is a way to study for NCLEX by focusing on the content, and I'm going to show you how it's done. Go ahead and get out your downloadable workbook so we can take notes. All of the information today is coming from our NCLEX virtual trainer. That's right, you're going to see this amazing program and how beneficial it is to help you get your nursing license. The NCLEX virtual trainer, this is the best resource I've ever created for nursing students to pass their exam. All of the Remar nurses are in it right now. They're loving it, and I want you to have it too. We cut the price to just $150, so you didn't have any excuse why you couldn't get this amazing resource. 2020 is coming up. I want you to have your license. I created this amazing product so you can take control of your learning experience. Let's make NCLEX preparation easy. Get the virtual trainer. We have it while supplies last. It's just $150. I'm so excited for you to get your license this year. Oh, it's going to be an exciting class. Let's get started right away. Hey guys, we are back in store for another amazing episode, 7 Days of NCLEX. This is the homework review. I hope you have enjoyed these questions. Now it's time to see if you got the correct answer. We're going to get right into it. Question number 1 simply says this. 55-year-old male was admitted to the psychiatric unit for management of schizophrenia. We talked about it. He isolated himself by remaining in his room and was observed to be staring at the ceiling, his head leaning to one side, and speaking to himself. He refused his food and medications because he said they were poisonous. Okay, Remar nurses, this is our patient. Question number 1. Which form of schizophrenia should the nurse document for the client? All right, so based off of all that we know about case studies, and you guys know I love case studies because they help us to really dive deep into a patient. Based off what we know about this client, is this paranoid schizophrenia, catatonic schizophrenia, disorganized schizophrenia, or depressive schizophrenia? Okay, guys, so the correct answer for this form of schizophrenia is going to be, you guessed it, paranoid schizophrenia. Yes, this patient has the positive signs. Here, they're suspicious. They're not eating any food. You hear them potentially speaking to themselves or others that are not there. This is the correct answer. Let's go on to question number 2. It says this. Which of the following areas are most important to the mental status assessment of this client? Select all that apply. So just again, we're looking for the areas that are going to be most important to the mental status assessment of the client. All right. Select all that apply. Number 1, the choices are diet, hearing. All right. Hearing is number 2. 3 is judgment. 4 is thought process. 5 is pupillary dilation. And 6 is personal appearance. So this could be a tricky one. Think about schizophrenia. What are you guys thinking? What are going to be most important if you're trying to do a mental status assessment of the client? Oh my goodness. The answers, all right, that are correct are going to be, this is what the nurse needs to focus on: the hearing, the judgment, and the thought process. Remember, we are trying to get a picture of the mental status. We want to know what's most important mentally, cognitive-wise with the patient. And so one of the answers were hearing. Well, we need to evaluate the client's hearing because we need to determine if they're talking to themselves, pretending like they're hearing something. We need to know, does this patient have a true hearing issue, or is their hearing fine and it's actually mental? Okay. The judgment, we need to know the clinical thinking of this patient. Do they know the time of day? Do they know their appropriate, situation? These are things that are going to help display whether your patient is with reality or with not reality. And then thought process as well. It just makes sense that we're looking for the mental status of the patient. All right. So this was the correct answer here for question number 2. And I hope you guys got it. Now, the diet, the pupillary dilation, or the personal appearance is not going to be the most important for the mental status assessment. Okay. 3. Which of the following indicators are diagnostic criterion for schizophrenia? Another select all that apply. And I'm hitting you hard with the select all that apply because they really help us to evaluate how much we know about a topic. So what are going to be indicators that a patient has schizophrenia? Number 1 says enhanced intellectual skills. 2, severe physical disability. 3, severe anxiety. 4 is word salad. And 5 is a fixed false belief. So what are going to be the what are going to be the most reflective of this condition called schizophrenia? What do you guys think? And I know we went over some of these when we talked about this condition during 7 days. So here we are evaluating what we studied. The 2 positive signs of schizophrenia are here: word salad and a fixed false belief. The other symptoms are not going to be a part of a diagnostic criterion. So I listed some other ones down here for you. With schizophrenia, you also can have delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and then also the negative symptoms. And this subject comes from the virtual trainer here. So the negative symptoms, if you're a REMAR nurse, you have VT, you did it, go ahead and put up what are the negative symptoms of schizophrenia, because you want to know the difference between positive and negative. And I promise you, your fellow REMAR nurses will appreciate you so much. Hey, this is our community study session. So if you have some helpful information that you want to add, please add it. This is the time. We're in the studying mode. And that's one thing I love about our community is that we come together and we make it happen. All right. I'm moving on. This is still the case study. Question number 4. Which of the following behaviors is the nurse most likely to observe when caring for this client? Is it number 1, regression, 2, suspiciousness, 3, emotional outbursts, or 4, abnormal body posturing? What are we going to expect with our case study patient REMAR nurses? What do you think? What do you think? The correct answer is going to be yes, this patient, because we already thought that they had paranoia, right? So they would be suspicious along with the paranoia. That is going to be absolutely a characteristic of our patient. Regression means that when you have a patient that's regressed, that means that they have reverted back to an old behavior. We usually see regression in children, right? You have a 5 or 6-year-old client, and when they get sick, they begin to bedwet, right? They make a mess feeding themselves. So that's what regression looks like. We're not going to typically see that in these kind of patients. Emotional outbursts is good. Positively, you might see an emotional outburst, but with paranoid schizophrenia, that suspiciousness is going to be really reflective of the paranoia. So that's going to be the best one. Abnormal body posturing, not so much. Let's move on. The next question is this, question number 5. You're going to like it. Which of the following nursing strategies is most appropriate to address this client's lack of desire for social interaction? I'm going to read it again just so we get it. It says, which of the following nursing strategies is most appropriate to address this client's lack of desire for social interaction? All right. Is it number 1, conduct only one-to-one counseling sessions with him? 2, initiate weekly group interactions as the main focus of therapy. 3, keep interactions short, frequent, and non-demanding. 4, offer infrequent attempts to establish a relationship with him. All right, so those are a lot. What do you guys think in terms of what's going to be the best for somebody who doesn't want a lot of attention? They don't want a lot of social interaction. The correct approach for the nurse to take is going to be keep interactions short, frequent, and non-demanding. Keep interactions short, frequent, and non-demanding. And I want to look at the other choices because I can focus on the correct choice. And shout out to everybody that got it right. That was kind of a tough one. But the other choices, I want to explain why they're not correct, even though I know some of them look really good. So the first one says conducting only one-to-one counseling sessions. Well, it sounds good because you have a patient that doesn't want to be bothered, that doesn't want social interaction. But what's the issue with this particular patient if it's always just you and him? All right. This is what kind of patient? This is a psychiatric patient. And so we try not to have exclusive relationships with psychiatric patients because they tend to interpret things wrong. So if you're only having one-to-one interactions with this client and nobody else, right, then there's a potential for a relationship to be built that you have no idea is being built. And so it's important for our state boards that we understand how we are relating to psychiatric patients. And the one-to-one counseling is not the way to go. All right. Initiate weekly group interactions as the main focus. Nope. The weekly group interactions cannot be the majority of the focus of the therapy. And then so 4 says offer infrequent attempts to establish a relationship. And that kind of sounds off. You want to have you want to have interactions that are time-based and have a certain frequency to them in order to build, in order to provide care. However, you definitely want to keep those interactions short and non-demanding from a person who has paranoia. Question 6 says this: which of the following pharmacological agents would be most appropriate for this client? Select all that apply. All right, and I want to put the emphasis on all because with this kind of question, any medication that has a correlation to this psychiatric patient and that could be helpful, we should choose. We should choose based off of the diagnosis. So number 1 says diazepam, 2 is haloperidol, 3 is fluphenazine, and 4 is lithium carbonate. All right. So what can we give to our schizophrenic patient that would be appropriate? That would be appropriate. And the correct answer is going to be, the correct answer for select all that apply, you can choose 1, 2, or 3. 1, 2, or 3. And if you know these medications, you can simply pick them based off of the class of the medication. So benzodiazepines are used for anxiety very, very, very heavily in clients with schizophrenia, right? Benzodiazepines work very fast, and you can give them for anxiety. So it's appropriate for a patient with schizophrenia, a patient who's suspicious, a patient who has paranoia. 2, haloperidol. This is an antipsychotic drug that is used for positive signs of schizophrenia. It decreases the excitement in the brain. That's kind of how it works, but wholly it's an antipsychotic medication. So anyone who is not in reality or in connection with reality can benefit from haloperidol. But we know when we're studying for our state boards that it has a ton of interactions, a lot of adverse effects. So we have to be cognizant when you give somebody haloperidol. We're talking psych medications here. I hope you guys know them. And then the last medication is a phenothiazine, and this is an antipsychotic medication that will also treat the positive signs of delusions, hallucinations, and or hostility in our patients. The lithium, we would not give this for schizophrenia. What do we typically give lithium for? What kind of condition? Lithium is a mood stabilizer that is very effective in clients with bipolar disorder, okay, bipolar disorder. So that one is not going to be appropriate, but the other 3 are. The other 3 are. Question number 7. Question number 7 is, okay, so that's the end of our case study. We got a new patient here. A nurse is caring for a child with bacterial meningitis. Which of the following would indicate the child has developed disseminated intravascular coagulation? Okay. Which of the following would indicate the child has developed another condition? This disseminated intravascular coagulation. Is it number 1, cyanosis, 2, pedal edema, 3, hemorrhagic skin rash, 4, lower side flank pain? Lower side flank pain. So, what do you guys say here? Do you know the condition? The only reason why we're doing these questions is because we're trying to identify, hey, I need to study more in this area. That's it. If you guys are getting them right, amazing. I'm so happy. If you're getting them wrong, let's work harder. Let's work harder, all right? The correct answer is hemorrhagic skin rash. Write this down if you don't know it here. DIC, or disseminated intravascular coagulation, one of the characteristics of it, or really the staple of it, is that there is activation of coagulation, bleeding, but there is no more clotting factors left. So your patients are just essentially bleeding without the ability to be able to clot the blood, all right? And so this is a severe problem. It's especially in children. And so as a nurse, you have to know, essentially, if I have a patient with DIC, how did they get it? And then what am I supposed to do about it? What am I supposed to do about it? So there you go. Let's go to question number 8. Question number 8 is this. Okay. A 6-year-old child is scheduled for a lumbar puncture. The nurse should place the client in which position for this procedure? Oh yes, this is a hodgepodge of questions. Let's go, Remar nurses. This is Let's Talk NCLEX, 7 days of NCLEX all in one. Number 1, side lying with legs pulled up and head bent down to the chest. 2, supine with a pillow under the shoulders. 3, prone with a pillow under the abdomen. Or 4, prone with a pillow under both knees. I'm talking lumbar puncture here. I'm talking what position is going to be best for the 6-year-old child. For the 6-year-old child, doesn't matter. Doesn't matter if this is an adult child or a 6-year-old, what position is going to be best? All right. And the correct answer is this, ladies and gentlemen. It is going to be, bam, number 1, side lying with the legs pulled up and the head bent down to the chest. Now, I don't want to explain it. I'm just going to show you guys a picture because I think it's worth 1,000 of my words. But remember, when you're trying to do a lumbar puncture in an infant or a child, we want to have that vertebrae stretched out as much as possible. All right, as much as possible, so that you can insert the needle in the proper position. Babies tend to be chubby, right? They tend to have a lot of fat on them, and so in order for the bones to push through the skin and you can feel them, you want to have the patient in a position that smooths and rounds out the spinal column. And so this is why for children, you're going to have them in this position. All right. Lumbar punctures for the children. Question number 9. We are moving on. Speaking of a lumbar puncture, let's keep going with it. A nurse is evaluating the lumbar puncture results of a child diagnosed with bacterial meningitis. Okay, a nurse is evaluating the lumbar puncture of a child diagnosed with bacterial meningitis. Which of the following laboratory results would be expected, okay, or would she expect? Number 1 says clear cerebrospinal fluid, decreased glucose or decreased protein. This is tricky. 2, cloudy cerebrospinal fluid, elevated protein, decreased glucose. 3, cloudy cerebrospinal fluid, decreased protein, decreased glucose. Or 4, bloody cerebrospinal fluid, elevated protein, decreased glucose. All right, these are our choices. This one to me is tricky because you have to evaluate multiple things at one time and you have to know your normals. So you have to know what normal cerebrospinal fluid is, but now you have to think if your patient has bacterial meningitis, does that make a difference? So I want to know which one you guys are thinking about, and don't be afraid, share this video if you know a nursing student needs to know this information as well. The correct answer, my friends, is number 2. Yes, somebody with bacterial meningitis, their cerebrospinal fluid, it is going to be cloudy. It is not going to be clear. It's going to be cloudy. They're going to have elevated protein and decreased glucose. I want to show you this tool. It was a good tool that I have found. I want to share with you guys. It is actually a chart of the two types of meningitis. Did you know that there were two types? There is. And there's a bacterial meningitis and a viral meningitis. And you can get a lumbar puncture with either one. So I wanted to show you guys the difference in the results of the bacterial meningitis and the viral meningitis. So let's just look at it together. If we're talking about a bacterial meningitis, you see that the glucose in the cerebrospinal fluid will be down, okay, for bacterial. In viral, it states that it will be normal or slightly lower, okay? Normal or slightly lower. The protein levels in bacterial meningitis, it will be elevated. In viral meningitis, it will be normal or slightly elevated. So you can see which one is worse, right? You can see which one is worse. And then the number of white blood cells you can see here are going to be increased. All right, it's going to be over 1,000. All right, over 1,000 for the neutrophils. And then for the viral meningitis, you have about 10 to 500 of the lymphocytes there, right? So you can see that the body is going to be really trying to get rid of this bacterial meningitis. It is going to have to work very hard, but essentially because there is actually a bacteria, a foreign agent, that this patient is going to need to have some antibiotics in order to get rid of bacterial meningitis. Where a viral meningitis, there is no organism present. And so the treatment is a lot different. It's less serious. Usually with viruses, you have to work them out of your body. Your immune system has to rise to the occasion in order to make you healthy. All right. And so our immune system can defend a lot of things, but with bacterial meningitis, you will need some assistance. All right, let's move on. You guys are doing good. This is what studying with a group looks like. And let me just say this, with 7 days of NCLEX, we have spent a lot of time focusing in on content. We spent a lot of time taking you into the virtual trainer so you can see what the full lecture experience is like. And so the homework is an opportunity for us to determine, hey, I've been studying my content, I'm doing well. Or it's an opportunity for us to say, I need to focus on this area before I test. All in all, I'm doing this because I want you guys to have an enjoyable time studying. I want you to realize that studying can be fun when you do it with me. That's all I want you to, at the end of the day, I want you to understand that I've literally helped thousands of nurses get their license doing just what you're doing, having a good time, being a nurse. All right, nurses, we get excited about stuff like this, and that's cool to me. Question number 10 says this. All right. I got to do the case study first. Let me do the case study. Here's our new patient. Case study number 2. A community health nurse visits a 52-year-old spiritual healer who is being treated for diabetes and a non-healing venous ulcer of his right foot. The client tells the nurse he has stopped applying the antibiotic ointment and taking his insulin Lispro on the advice of a herbal healing book. Okay, he is wearing a religious medal that he acquired after reading the herbal healing book. Okay, does everybody understand our patient? Does everybody understand what's going on here? We got a 52-year-old client. He's religious, all right, but he's also diabetic. And what kind of diabetic is our client? Is he a good diabetic? Is there such a thing? Is he a compliant diabetic or is he non-compliant? At this point, just from a pharmacological standpoint, this guy is non-compliant. He's not taking his insulin and he's not taking his diabetic foot ointment. All right. But we know that he's into healing. He has a medal on and he's wearing it for a spiritual purpose, from his herbal healing book. So what are we doing with this patient? Question number 10 states this: which question about the medal would be most appropriate for the nurse to ask? Is it number 1, will you tell me the significance of the medal to you? 2, what is the reason for wearing the medal? 3, do you think that the medal will help heal your foot? 4, do you want to wear this medal in the hospital? All right, so here the nurse is basically doing a spiritual assessment. What do you guys remember about spiritual assessments from 7 days? What did we say was very important? All right, the question that's going to be most important to ask is, will you tell me, number 1, will you tell me the significance of the medal to you? All right, as part of our assessment, we have to allow the patient to communicate where they are. We have to allow the patient to tell us, this is my faith. This is how I'm expressing it. And that's part of cultural competence. That's part of cultural competence. All right, let's do another one here about this patient. So the client agrees to be treated in the local hospital. The client agrees to be treated in the local hospital. The healthcare provider orders an X-ray of the right foot. The client insists on wearing the medal. Okay. Which of the following is the most appropriate action for the nurse to take? All right. Is it number 1, removing the medal in the client's room and wearing it until the client returns from the X-ray? 2, promising the client that the medal will be safe until the client returns? 3, sending a written note with the client that the medal can be worn during the X-ray? Or 4, requesting that the physician order an alternate diagnostic procedure? Or one more, 5 says removing the medal just before the start of the X-ray and then returning the medal to the client when the X-ray is completed. All right. So out of all of these choices, what should the nurse do? What's going to be most culturally competent? What's going to be the best for the client? He wants to keep the medal, but he has an X-ray. So what should the nurse do that's most appropriate? I hope you guys thought it was number 5. Yes, removing the medal just before the start of the X-ray. Yes, and then returning the medal to the client after the X-ray is all completed. That's the best thing for the nurse to do, because you're stuck you're stuck between a rock and a hard place, because we know that if a client is getting an X-ray, that they cannot have on any jewelry. They can't have on any jewelry, but the client is saying, this is important to me and I want to keep it. So the best thing for the nurse to do is allow the patient all the way up until the procedure to keep the medal on, right? To keep the medal on, and then take it off and give it to him right back at the end of the procedure. I want to look at the other options here. So number 1, for anybody that thought number 1 would be appropriate, it's not appropriate to remove the medal and then have the nurse put it on. Like, you would not do that, all right? Because it's a healing medal, and then you wouldn't want the healing powers to be transferred to you. Like, the client would not want that, right? So we're not going to do that. 2 sounds good, promising that the medal will be safe until the client returns. But we as nurses cannot make those, we cannot promise it, because we don't know. Something might happen, it might get stolen, and then you made a promise that you can't keep. So 3 says sending a written note that the medal could be worn during the X-ray. No, that's out of our scope of practice. We cannot do that. We cannot defy the laws of the machine. And then 4, requesting that the physician order an alternate diagnostic procedure. This may sound like you're advocating for the patient, but it is highly irregular for a client to get an entirely different medical exam based off of a piece of jewelry, okay? So you would do what's best, which is number 5, Hey, let's go on to question number 12. All right, different patient in the case study. All right, we got now a 73-year-old hospitalized client refuses her bedtime sleeping medication. The client has mild cognitive impairment. Which is the best action by the nurse? They have a 73-year-old, doesn't want to take the bedtime medication. What is the correct action by the nurse, the best? Number 1, notify the healthcare provider immediately. Immediately notify the healthcare provider. 2, comply with the client and document the interaction. 3, explain to the client the importance of proper sleep and insist on the medication. Or 4, notify the family to discuss the client's request. Okay. The best action for the nurse to take in this situation, with everything that we know about this patient, is going to be, what do you guys think? Is going to be number 2. It's simply comply with the client and document the interaction. And let me tell you why. Because from what we know about this patient, they still should be able to make their own decisions about their care. Patients having control, patients having autonomy is a huge staple, all right? So even though it says that this is a 73-year-old client and she has mild cognitive impairment, we do not, number 1, let's look at the choices again, all right? Number 1, notify the healthcare provider immediately. There's nothing to tell the healthcare provider right now, right? She doesn't want what? Her bedtime sleeping medication. She doesn't want to go to sleep. She doesn't want to take it, right? So if we call the doctor, he's going to say, so what? She doesn't want to go to sleep. Document it, all right? The doctors, they're going to be like, all you have to do is document, because you have to think about it. When you call the doctor, what do you expect the doctor to do? All right. So if you're calling the doctor and you say, this client is not taking her Ambien, what power does the doctor have? All right. The doctor is going to be in a situation where they're going to say, there's nothing I can do about that at all. So we want to make sure that our communications with other interdisciplinary team members are effective and beneficial. All right. So the other choice says, explain to the client the importance of proper sleep and insist on the medication. All right. We talked about this during RNU, Remar Nurse University. Nurses do not have the ability to do that. And when you do that, you're taking away your patient's autonomy. All right. It's called paternalism. And nurses cannot be paternal to our patients. We cannot. All right. 4, notifying the family to discuss the client's request. Well, this is all types of HIPAA violation. All right. So even though this is an elderly patient, you cannot assume that you can give their information to anyone. It's just not going to happen. All right. Question number 13, we have a new patient. It says, a 35-year-old client has just been told that she has terminal cancer. Her husband and 3 children are present, and while speaking to the nurse, they are in great distress. Which action is most appropriate by the nurse? Number 1, inform the client that the healthcare organization has an excellent treatment program. 2, acknowledge the client's feelings and let them know that there is still quality time for them to spend together. 3, recognize the difficulty of the situation and ask if they would like to spend some time alone. Or 4, tell the client and family not to lose hope or give up. all right? Not to lose hope or give up. So the correct answer here in this situation is going to be 3. Recognize the difficulty of the situation and asked if they would like to spend some time alone, all right? So essentially you have here a family who is in distress. They're probably crying. They're very upset. So if you do number 1, telling the client about the excellent cancer treatment program is not appropriate at this time. It's not appropriate because the client has just been given a terminal diagnosis. So how great can the treatment center be if they're saying that the client is terminal? So this is not going to be beneficial or well received by the family. 2 says, acknowledge the client's feelings, which sounds really good, right? So if we're not reading, we'll just go with this because it says acknowledge the client's feelings, which we know we're supposed to do. But it says, and let them know that they still have quality time together. And that's not good because the nurse's definition of quality is probably very different from theirs, right? So quality time, is it 3 months? Is it 6 months? Is it a year? None of those things may be long enough for that family, all right? So it's not appropriate. And then the final option choice says, tell the client and the family to never give up, never lose hope. And again, when it comes to these situations, we want to keep our personal bias, our personal feelings out of them as much as possible. So the best thing to do is ask the clients would they like to be alone and allow them to grieve in the way that they want to do that, okay? All right, number 14 on your papers, and I hope you guys have done these already, and so now you're, just checking over your answers. Number 14 says, a 93-year-old client tells the nurse he wishes to speak to his mother. Which of the following is the best response by the nurse? All right, number 1 says, I will try to locate her, but it may be difficult for me. 2 says, is there anyone else I can contact instead? 3 says, begin speaking and your mother and I will hear you. 4 says, I know it must be difficult for you to be alone, okay? So when we're talking about here, a 93-year-old client, they want to speak to their mother. It's probably about 100%, chance that their mother is not there. What is our intentions? What is our best intentions as healthcare providers? What do we want to do? All right? How do we want to treat this patient? How do we want to be therapeutic? The best thing for us to do is to respond in this way, which is, I know it must be difficult for you to be alone, right? So this is allowing the patient to speak to their current situation. So it's a form of redirection. It's a form of redirection for the client because usually people want to talk to their moms when they're lonely, when they're afraid, when they want to have some conversation. You call up your mom. So this is allowing the patient to perhaps speak to the nurse and get some things off of their chest. If we look at the other options, and really this is the game of NCLEX, just picking what's best in front of you. If you say number 1, I will try to locate her, but it may be difficult for me. Yes, I don't know. Right now, if you say that, then the patient could very well tell everybody else that you're going to locate their mother, And so you have to be very careful because sometimes patients will hold on to things and they'll hold you to it. So don't even offer to try to locate the mother, all right, or anyone else that may be deceased. 2 says, is there anyone else I can contact instead? Well, this is ignoring the client's initial request, all right? They specifically said they want to speak to their mother. So if you propose that there's somebody else, you may get an argument. 3 says, begin speaking and your mother and I will hear you. Well, this is participating in the delusion or the altered sense of reality, right? And so as a nurse, we don't want to do that, because then the patient could think actually you have the mental illness. Like, you just want me to start speaking and my mom will hear me and you will hear me. And so at all times, we want to make sure that we're being professional with our patients, and we don't want to get involved into their delusions or hallucinations or altered mental status in general. All right, let's go on to the next question. I liked it because it's here. You have a dual issue going on. So you have a nurse is caring for a client diagnosed with schizophrenia and hypertension. While lying flat in bed, the client begins to have an acute myocardial infarction. The client suddenly becomes short of breath. Which is the priority action for the nurse to take? So is it number 1, ask the client to take deep breaths. 2, elevate the client's feet onto pillows. 3, place the client in semi-Fowler's position. Or 4, take the client's vital signs. So this is a great priority question. You have a patient with schizophrenia, and then all of a sudden they're having an acute MI. What is the priority here for this patient? The correct answer is from ask the client to take deep breaths, just going over the items again. 2, elevating the client's feet on 2 pillows. 3, placing the client in semi-Fowler's position. Or 4, taking the client's vital signs. The correct answer is going to be number 3. Yes. The semi-Fowler's position is going to allow the client to have maximum air exchange, right? And so the situation here is the patient was lying flat in bed, right? And they began to have an MI. So what we need to do is ask the client to take, let's look at the other choices here. Asking the client to take deep breaths, that sounds really good because we want to get more oxygen into the patient. But what we have to do is position them to be able to fully expand the lungs, to be able to actually get some benefit from the deep breaths. And being in the semi-Fowler's position first is going to help make that experience better. 2, elevating the client's feet on pillows, not going to do much for the client with myocardial infarction pain or increased oxygen demands, decreased tissue perfusion. And so those are not going to be the correct choices. The last one says take the client's vital signs. Okay, I'm going to encourage you guys, whenever you have a patient in acute distress, do not run and go get a machine. Do not start to try to take vital signs, check urine output. Do something for that patient that will help make them more comfortable, help reduce the pain, help increase the oxygenation. Usually taking vital signs is not going to be the correct answer. It sounds good, but it's not proper to evaluating or assessing your patient, right, in an emergency situation. Okay, and the next question is about telehealth, and I tried to incorporate telehealth into the virtual trainer with questions and things like that. You guys will be familiar with this if you're a REMAR nurse. It says, a telehealth nurse is calling Mr. White to discuss his recent employee physical examination. She has been directed by Mr. White's employer to call him. When the nurse calls, Mr. White states he does not want to discuss his results with her and hangs up. Which is the most appropriate action by the nurse? So we're talking about telehealth nursing. What is it? What is the response of the nurse when she calls and the patient hangs up on her? Is it number 1, call Mr. White back and start the conversation off by stating the purpose of the call? 2, notify the healthcare provider of Mr. White's behavior. 3, document the behavior. 4, notify the healthcare provider and then document the client interaction. All right. What is the correct response by the nurse? I know this one is so good. Listen, I understand. I want you to give it your best. Even if you've never seen anything about telehealth nursing, this is about challenging yourself. So that's what I want to do. I want to challenge you guys here. What do you think the correct answer is? Okay, I can't wait any longer. I got to tell you, the correct answer is document the behavior. Yes, yes, yes. Remember, the telehealth nurse assesses essentially this the client's lifestyle pattern, right? It's an educational position. You're going to provide education to improve the health care of the patient, decrease risk factors, right? So 3 is appropriate. The nurse should document the behavior. This client is not under any obligation to talk to you at all. If you are a telehealth nurse, you have really no say-so in the direction of their care. It even says in the question, it was Mr. White's employer. So his job had a telehealth nurse call and ask questions. So it's not under any obligation that Mr. White has to talk to the telehealth nurse. So I want you guys to realize that. I want you to remember that for your exam, okay? And essentially, definitely number 4, notifying the healthcare provider. Oh, absolutely not. The telehealth nurse does not need to notify the healthcare provider at all. Again, it's usually an outside affiliation. Here we see that it's done by the patient's job, so she would not be calling that patient's physician. Hey, how'd you like studying the homework review with me? Did you know that you can pass your NCLEX? You will pass your NCLEX. You absolutely must pass your NCLEX. And so 7 days of NCLEX during the holiday season, when others are sleeping and eating and enjoying the life that they have, we're trying to get to the next level. And I like this level with you guys, but I want you to get to the next level. And so this amazing NCLEX experience has been brought to you by my favorite right now. It is the virtual trainer. Get the #1 NCLEX resource. I'm calling it the #1 NCLEX resource because literally there's nothing like it, nothing like it. And right now, you guys are able to take advantage of our 7 days discount, the very best discount that you can get for this program. And I just want to remind you, during the holiday seasons, sometimes we buy things that the next week have no real value and they're not life-changing. And so I want you to make this 7 days count. Make this 7 days of NCLEX matter to you. And so at the beginning of 2020, you guys can take your exam and be prepared. One of the best gifts that I can give you guys is my knowledge. And I've been doing this for a long time, and I've seen cases where nursing students literally have given up hope. But then it just took one video. It literally just took one video, and they did a study session with me, and they said, I'm going to give this another try, and it changed their life. And so I want that miracle for you guys. I want you to experience, I want you to have it, but the step begins with you, all right, with you. So I'm telling you guys, if you don't have the virtual trainer, get in that program because it will work you. It will hold you accountable. Remar nurses back me up on this who have the VT. The virtual trainer is the best NCLEX review out there right now, period. There is nothing like it, and you guys have been experiencing it over the last 7 days. So I just want to thank you and let you know, hey, we still have another day. Keep studying, keep believing that you can, you will, and you must pass NCLEX.
Good morning, Remar family. My name is Latasha Murray. I am a repeat test taker, and I am coming to you guys this morning pretty much to compare and contrast the Ultimate DVD package with the VT Trainer. So let's start with the package. So I purchased the Ultimate DVD package last Black Friday. So I'm not sure if you guys know, but it comes with the quick facts, it comes with the advanced study DVD, the self-study PN, a student workbook, what is this? A question book, and an activity book. Out of all of this stuff, I wanted to give myself the best possible chances of passing since I am a repeat test taker. I did graduate over 10 years ago from VN school, so I wanted to give myself the best chance of passing, so I wanted everything that it came with. However, I didn't really start studying until May of this year. I picked up a few times here and there. After the Monday motivations, I would study a little bit, and then I wouldn't study, and then I would study again. But I scheduled my NCLEX PN for December. So I really started studying last month, consistently. The thing I was really studying was my quick facts. So this quick facts is a lifesaver. Like, everything in here, I am like committing to memory. The only issue I have with the Ultimate DVD package is there really is no accountability. There's no way to fully know if you know what you know. Like, some stuff I can say committed to memory, the first 20 pages of quick facts are already downloaded in my brain. Like, I got it. You can ask me anything about, benign prostatic hypertrophy, I got it. But the only issue is I have no way of checking myself. Like, I don't have another nurse in here to tell me if I'm, getting pharmacology right. Like, that's the only downside of this. So even with hesitation, I purchased the VT on Friday, Black Friday. I've been in there for 2 days, and it is amazing. The graphics, the technology, the 4K, the discussion boards, the rooms. But before the books arrived, that section has been hands down exactly what I needed. So it's kind of like you are able to see where you are and what you know from the fundamentals of nursing. And that is what I needed to know. And so I love it. So I am grateful. I'm over the moon. I'm excited to even make this video and say, go get it. Like, if you haven't purchased anything from Miss Regina, from the Remar family, I would say get the VT along with the quick facts. The quick facts will save your life. This is definitely the lifesaver that you need along with the VT. The VT will tell you where you are, where you're going. And I love the fact that it's a 95% pass rate. That's the thing that keeps me going. Because I'm like, if I pass it with 95%, I know it. And if I don't know it, it's going to keep telling me that I don't know it until I know it, which is where I need my accountability. So I would say get the quick facts, get the VT. It comes in a package that will help you study.
Welcome to the 7 Days of NCLEX. My name is Regina, MSN RN, and I've dedicated the last 10 years of my life to helping students overcome anxiety, pass NCLEX, and get their nursing license. There is a way to study for NCLEX by focusing on the content, and I'm going to show you how it's done. Go ahead and get out your downloadable workbook so we can take notes. All of the information today is coming from our NCLEX virtual trainer. That's right, you're gonna see this amazing program and how beneficial it is to help you get your nursing license. The NCLEX Virtual Trainer, this is the best resource I've ever created for nursing students to pass their exam. All of the REMAR nurses are in it right now. They're loving it, and I want you to have it too. We cut the price to just $150, so you didn't have any excuse why you couldn't get this amazing resource. 2020 is coming up. I want you to have your license. I created this amazing product so you can take control of your learning experience. Let's make NCLEX preparation easy. Get the virtual trainer. We have it while supplies last. It's just $150. I'm so excited for you to get your license this year. Oh, it's going to be an exciting class. Let's get started right away. Happy New Year! We finally made it to 2020. I'm so glad that we brought in the new year together. This is 7 days of NCLEX, the final day. This is our open house. We're talking about all the good stuff that you need to pass NCLEX. Hey, are you excited about the new year? Do you see the possibilities? This is the future and we're here, 2020. I can't even imagine how good it's gonna be for those in the nursing profession. But what I can imagine is you passing your NCLEX exam. So this is our open house. Welcome to 2020. I have a lot to tell you. I have a lot to tell you guys. I'm gonna tell you all the things. Here's what we're gonna start with. The 3 things you must know if you're preparing for NCLEX in the year 2020. And these are my secrets. I'm just giving you guys my secrets. I've been doing this for 10 years. I've been passing NCLEX for 10 years through you guys. So the things that I'm going to share with you today are supposed to inspire you, educate you, entertain you, but give you a sense and a peace of mind that I'm on the right track. Studying with REMAR Review, you're on the right track. So here are the things. I want to maximize your time. I want to increase your efforts. I want to improve your odds of passing NCLEX the first time or the next time if you're a repeat test taker. Either way, we want you to pass. So did you know this, that out of all the things that you're studying, it's so important. The secret of passing NCLEX is to study only what will be on the exam. I mean, this could be a thought that's pretty mind-blowing, but a lot of us are wasting time studying for things that will never be on the test. And you may be saying, well, Regina, how can you say that so confidently? Well, here is a secret of the exam. Here it is. Out of the categories in the NCLEX RN and NCLEX PN test plan, every category has a task statement associated with that category. So that means that there are specific activities that are going to show up on your exam. I mean, when I say I've been doing this, I've been studying this test for a very long time. I understand the information that is important and the information that is not important. So when I talk about there are these task statements, when I talk about there are these activities, where am I getting them from? Well, I'm getting them from the research that if you are an entry-level nurse, there are certain tasks that are more commonly, routinely done by registered nurses and practical nurses, all right? There are things that you will almost undoubtedly do during your first year of nursing, and then there are some things that you may or may not do. So NCLEX prioritizes those tasks, basically. So for example, high priority tasks are prioritization. Can you prioritize a list of clients or a list of responsibilities associated with a particular client? Can you do therapeutic communication no matter what aspect of nursing you find yourself in, whether you're med-surg, pediatrics, psychiatric, surgical, you must be able to perform therapeutic communication. Do you know the assessment findings of multiple diseases? Do you know how to execute the nursing process? And so every category has a task statement, and I literally develop the virtual trainer around these high priority tasks. They're no mystery what the high priority tasks are. I tell you what they are throughout the course, but also check this out. If you have the virtual trainer, or if you're thinking about getting the virtual trainer, how about this? In the virtual trainer's file vault section, where I keep all of the files for you guys and resources, I actually put the 2018 high priority tasks for nurses. So right now, if you have the virtual trainer, you can go in there, go to your file vault and get that document. And in that document is the actual research findings. And I wanted you guys to have it. That's one of the benefits of the VT, is that the information that I can get and the information that I do get in research, I can share it with you immediately. So if you're thinking, oh, I would love to know what all of the high priority tasks are, guess what? VT is waiting for you to go in there, print it out, and grab it so that you can have it for yourself. I'm talking about the things that are going to help you pass in the new year. I'm talking about what we're doing differently here at Remar Review to support you guys so that you get your nursing license in 2020. Okay, so another thing that I want you guys to not do anymore, all right? All of the large content books or your nursing school notes, you cannot use these to study for NCLEX. All right, you cannot use these books to study for NCLEX. And I love them. You guys know I really do appreciate a good reference book, and I have a ton of them. But when it comes to studying for NCLEX, we have to let this go, because this exam, like I said, it is based off of specific nursing activities, and it's not all encompassing. It is very detailed as to what you need to demonstrate. And so a lot of my nurses that are with us for this year, you guys have not graduated yet. You're still in nursing school. You're studying as part of a group, and you're getting ready for your, finals and things like that. You have to understand what you do in nursing school does not directly transfer to that NCLEX exam. I can probably confidently say about, more than half of nursing instructors have no idea what's on the NCLEX test plan. They couldn't explain it to you. They wouldn't know the categories. And so these are the teachers who are writing your courses. These are the teachers who are giving you exams, and they may not be at all directly related to the NCLEX test plan. So if you're using your nursing school notes for this exam, you better make sure that what you're studying is one of those high priority tasks or falls in line with a specific category. And so I love these books, guys, but we have to go about getting more precise on what we're spending our time studying, because this right here is ineffective and a lot of just wasting hours that you could be doing something else. And so I'm saying, don't do this. Don't do this. Instead, consider this. Consider a comprehensive test plan that is actually based on the NCLEX review. And what I'm showing you is actually how I broke down the days for you to study. So I needed to make sure that you guys were studying everything that I created for you all to help, the same things basically that I use to help other people pass NCLEX. I wanted to make sure that you guys had it, but you also had an organized way of studying it. So I put in calendars for every week of your 6-week program, right? And you see here that this is what the full page looks like if you print it out, but this is just a snapshot of one day. So I have you studying literally in minute increments. So this is a topic in the VT. So from 8 to 8:15, you are watching the intravenous therapy video. And this is for the RN. You're watching that video. From 8:15 to 8:35, you are watching IV fluids. So there's no mystery about what I'm doing. Oh, I'm watching something right now. I'm supposed to be watching something, right? 8:35, you're watching TPN. 9:15, you're taking a break. So literally, one of the secrets to Remar Review is that I break the content down into digestible pieces for you to study. It's called chunking information, and I'm a big chunker. So I'm trying to lay out a process for you to feel comfortable, but also for at the end of your study session, you can look, and like I have the column here that says done. You can literally check off each activity that you do, and at the end of your study session at 10:45, you can see that I have done these things. And so if you're studying from one of these resources, you're going to have a hard time determining if you're really making progress. There is no breaks. There's no progress exams. There is no way to really have that accountability as to what you're doing. And so the virtual trainer solves all of those problems when it comes to preparing for this exam. I mean, here, do you have all the information you need to pass NCLEX? Yeah, you probably do. But good luck trying to organize it and find it and make sense of it. So we want to make things easy for us in 2020 because we have a lot to accomplish, and we don't want to spend the entire year studying for NCLEX. We want to get this done in 6 weeks and move on. So those are the 3 points that I really want us to remember, that this exam actually has a blueprint. It actually has a specific structure. Also, what we did in nursing school is not going to be effective when it comes to preparing for this test. And once you get past the understanding of I have to do something different, then it's just a matter of what to do. So I'm so happy that the Remar nurses you guys continue to share your testimonials and just really help to usher in the next generation of Remar nurses. We're in a new year, we're gonna do things differently. But because this is 7 days of NCLEX, guess what we're going to get into? We're going to get more into the virtual trainer questions, and we're going to practice some questions right now. Okay, let's get into this. A pharmacology review right here. Question number 1 says, a client demonstrates laryngeal edema and shock after a single dose of penicillin. Which interventions are the most important interventions at this time? Select all that apply. So here we go. We have a client. They are having laryngeal edema and shock after a single dose of penicillin. So which of the interventions are going to be the most important? Select all that apply. Number 1 is epinephrine. 2 is a tongue blade. 3 is oxygen. 4 is tracheostomy. 5 is a nasal gastric tube. What are we thinking are going to be the most important at this time for our patient? And I love this because this is priority of care, one of those high task priority statements right here. The correct answer is, okay, number 1, epinephrine. Number 3, oxygen. We want this patient to have oxygen. And did you pick tracheostomy? This is going to be important because our client has laryngeal edema. So that means that the swelling is going to be prohibitive to allow an airway. So we're going to have to create another airway for our client, and the tracheostomy is going to allow us to do so. Hey, you know what? I want to go over some important topics. So if you're filling out your worksheet, our topic number 1 is going to be select all that apply questions. This was just a really good example of a select all that apply questions. Here are my NCLEX tips for them. Select all that apply questions are also called multiple response items, okay? Multiple response items. So if you're reading any literature or if you're studying what changes or anything like that, NCLEX can call them multiple response items or select all that apply questions, item types. Here is my secret of how to do these questions. I really, number one, I turn each answer into a true or false statement. That's the first thing I do. So, for example, if I go back to the question here, every item that I have here, I'm literally asking myself, is this true as an appropriate treatment for this situation? So I have a client here has laryngeal edema after essentially penicillin. So number one, epinephrine. Is it true or false that I would use epinephrine for anaphylactic shock? Yeah, that's going to be true. I definitely would do that. What about two, a tongue blade? Would I use a tongue blade for anaphylactic shock? What is a tongue blade? What's the purpose of it? Well, it allows me to visualize the back of the throat. In an emergency, do I need to do this? It's going to be false. I don't. Three, if I'm doing the same thing, I ask myself, is oxygen appropriate? True or false? Yes. Tracheostomy, is that going to be an appropriate intervention for someone in shock with laryngeal edema? Absolutely. What about the nasogastric tube? Am I going to be trying to put down an NG tube during anaphylactic shock? No, I won't. So if you're using this method, it's going to help you not to get distracted by the multiple answer choices. We know that more than one is going to be right. So how do we rid ourselves of the distractors? So just to clear up any confusion, I like to turn them into a true or false statement. Also, number two says, this is it. You will need to choose all of the correct answers in order to clear the question. The correct answer can be one or all the items answered, okay? And this is just the truth of how it's structured. When you're doing a select all that apply question, you can just have one right, or all of them can be right, or just three of them can be right, or two of them can be right. And so the statement was made by NCBSN that it could just be one item response, or it could be all of them. So there's no partial credit right now for SATA questions. You have to answer all of them correctly in order to clear it on your NCLEX exam, okay? All right, so we're talking select all that apply questions. Now let's try another one here. I have this. Okay, question number two. A nurse is caring for a client who was involved in a severe motor vehicle accident. The client's attorney comes to visit the client and requests medical information to validate a proper lawsuit. Okay, do you understand what's going on here, guys? What is the best response by the nurse? Is it, number one, inform the attorney on the client's medical treatment? Two, contact the hospital's ethics committee. Three, call the nearest of kin to obtain consent to speak to the attorney. Or four, notify the physician. So we have a client, they're in a severe motor vehicle accident, an attorney shows up and their attorney is requesting medical information, okay? What is the appropriate response by the nurse? What do you guys think here? It should be very straightforward and very clear what that nurse should do. However, if this is a new topic, you might not know and it may be pretty tricky. So I wanted to go into the legal issues of nursing because this is another one of those high priority task topics. You need to be able to understand confidentiality for your patients. So my NCLEX tip number 2 topic is legal issues. Write that down, legal issues. And my tips for this topic when it comes to requesting medical records, all your responsibility lies in just verifying that a written consent is in place. Nursing staff should verify the written consent before releasing any information. Now, if you can't find one, then the only thing for you to do as the nurse is to contact the healthcare provider. That's it. Somebody asked for me to tell them the client's vital signs, laboratory work, test results. I go to the chart. I look for a consent durable power of attorney. If I don't see one with your name on it, I cannot tell you that information. I'm sorry. That's confidential. I have to protect my patient. Now, if they insist, yes, you can tell me I'm the daughter, I'm the oldest child, I'm this, I'm the uncle, I'm the cousin. Hey, let me call the doctor so he can speak with you. That's all we have to do as nurses. We just pass the ball to the appropriate player, which is the doctor. That's it. So I don't want you guys to feel like these other things come into play. So the correct answer, if we're looking at the question, is going to be notify the physician. Notify the physician. All right. And once again, if we look at the other statements, even if you thought that they sounded good, number one, without that consent, we cannot give any other individual a client's information. So giving the attorney information is just out of the question. Contacting the hospital's ethics committee, no, this is not calling for any contact of any committees. It's either there's a consent in place or there's not. 3, call the nearest of kin to obtain consent. Well, nope, not again. Another adult cannot give consent for any treatments or any release of medical records unless they are the durable power of attorney. All right, durable power of attorney. Let's do number 3 here. My third topic, let's read it and see if you can guess what it is. It says, a nurse manager has received a formal complaint about a nurse who is physically abusing elderly clients on the unit. The priority action for the administration is to do which of the following? Number 1, notify the local authorities. 2, notify the appropriate board of nursing. 3, notify and file a complaint with the hospital's legal team. 4, write an incident report including physical evidence gathered in the chart. Oh, this is so good. A nurse manager has received a formal complaint about a nurse who is physically abusing elderly clients on the unit. The priority action for the administration is to do which of the following? I hope you guys pick this. Go ahead and put your choices down. I hope you guys pick this answer. It might surprise you. I don't know, but it is number, what do you think it is? It is number 1, notify the local authorities. Some of you guys might be shocked, like what? Not notify the appropriate board of nursing, not notify and file a complaint with the hospital's legal team, not write an incident report. Nope, nope, nope. Because the clues are in the context. The content gives you the answers. This is an administrative position. There has been a formal complaint. What does a formal complaint mean? A formal complaint is somebody has taken the time to write out documentation, to provide their own evidence. And so nurses are what? We are mandatory reporters. So you have this situation where physical abuse of elderly clients is happening in a hospital environment. You have to notify the local authorities, no matter who it is. The appropriate board of nursing, they're not the first contact. They're not the first contact. You will get the local board of nursing involved when formal charges are brought up by the authorities to that individual. All right, so the authorities have to bring about the formal charges. It is the authorities, it's the police who charge people with crimes. It is not an individual task when it comes to abuse for the board of nursing to do. So they would be the step after, if that makes sense. Let's look at the other choices here. Notify and file a complaint with the hospital's legal team. Well, that may actually be done by the family. They will probably be filing the complaint with the hospital's legal team, but it is the action of the administration to get the authorities involved. And then you probably, the nurse manager here probably will notify the hospital's legal team and prepare them probably with the idea that a lawsuit may be coming. You never know. And writing an incident report is good. However, that should be done after the authorities have been notified. However, the way it's written here makes it inappropriate because it says write an incident report including physical evidence gathered in the client's chart. So we don't want to put incident reports in the patient's chart at all, ever. All right, we don't even want to refer to them. So out of the options that are given here, the most appropriate one is to notify the local authorities. That is going to be the next action after a formal complaint has taken place. When you talk about mandatory reporting, here are two things that I want you to keep in mind. Here are other mandatory reporters, okay? It's not just nurses. Physicians are mandatory reporters, meaning that you have to report any kind of child abuse or elder abuse. Nurses, home health aides, clergy members, social workers, attorneys, and teachers. These all are service workers in the service industry, and so they are expected to protect the public. Did you guys know that? So I thought it was interesting and also needful to know, because a lot of our NCLEX questions that we get are about interdisciplinary team members and how they help and how they contribute. So it's important for us to know the functions of the other disciplines. Also, let me tell you guys this. Let me ask you this question, actually. I'll ask you a question. Can a healthcare provider tell a nurse not to report suspicions? Can a doctor say to a nurse, I don't want you to report this incident. I have my suspicions about it. You know, what if a doctor approaches you and says, I know it looks like signs of abuse here, but I'm not sure, so I don't want you to report this. What should the nurse do? Do we defer to the doctors if the doctor tells us to not report a suspicion of abuse? What do you guys think? All right, it's a great question. Can a healthcare provider tell a nurse not to report suspicions? Well, my friends, that answer is going to be a big no. Yes, no, I couldn't fool you guys. That answer is going to be no. Healthcare providers they cannot ever tell a nurse, don't report a suspicion. Oh my goodness, that's not going to be good. All right. How about this? Let's do another question. I like the questions because they help us to identify weak areas and give us things that we need to go over. So the question is this. A nurse suspects a 3-month-old is being physically abused. Which laboratory test will be most likely to validate this suspicion? All right, we're looking for validation. So is it the MRI, the coagulation studies, the nutrition panel, or the chemistry panel? I'm not even going to say anything. This is a reading comprehension. So what do you guys think? We're talking about physical abuse. I'm just going to give you a second to put the answer down and try to rationalize on your own what is the correct answer, and I'm going to go over the answer with you guys. Okay, so we're talking about physical abuse here. Let me just show you the right answer. The right answer is coagulation studies, because the coagulation study is going to help us to determine if we see a child with bruises all over their body, 3-month-old, and they have bruises on their back and their legs. Well, the coagulation studies will tell me if they have normal bleeding times, right? If they have normal bleeding times and no issues of hemorrhaging or bleeding, then I know that they've been physically hurt, and that's why there's a bruise there. But if they have abnormal coagulation studies, they have a potential risk for bleeding out, right? And I see bruises, then I can say to myself, well, bruising is kind of normal, so or bruising is expected with these coagulation studies. So if somebody picks them up or holds them, then they may bruise easily. So this is going to be the best indicator. We're talking about physical abuse. So the MRI is not going to show us, MRIs, they show us small growths, they show us hemorrhaging in a sense of a large capacity, but it's not going to tell us whether that hemorrhaging, any growths, any bruises are normal or not. The nutrition panel will show us whether the child is being fed properly, malnutrition, but it won't show us physical abuse. Nutrition panels can be used possibly if you talk about the different types of abuse, neglect. Nutrition panels can show us whether a child is neglected or not if they don't have an adequate protein level, right? So that's neglect as opposed to physical abuse. And then the chemistry panel, not gonna show us too much at all. So I think between the MRI, the coagulation studies, and the nutrition panel, we are able to now say to ourselves why one is better than the other. So those are my topics. I wanted to direct you guys to specifically those points. Specifically, understand mandatory reporting. Understand that nobody under any circumstance can discourage you or deter you as a nurse from doing so. All right, so look over the top 3 topics that I had to talk about and add them to your study notes. As part of 7 Days of NCLEX, my goal is to give you what to study and then make sure that you're drawing your attention back to it. There is a process to passing NCLEX. I don't want you guys to lose hope when you're not with our community all the time. Like, so, you know, I love studying with you guys, and I know you feel energized and motivated when I'm in front of you, but when I'm not in front of you, I need you to be in the virtual trainer, because that will keep you accountable to your studies, and that will keep you motivated and happy and like ready to go, right? Ready to grind. So what I want to do now is, you guys know with the virtual trainer, and I can't believe this sale that we're doing is phenomenal, but you guys know with the virtual trainer, you get the virtual trainer workbook and you get the quick facts. So a lot of you guys are taking advantage of the sale and you're waiting for your VT workbook to come. So how I want to do the last day of our open house is I want to go over the quick facts book with you, just like I am your #1 study buddy. I'm always so excited to study with you guys. So what I want you to do, on your downloadable workbook, you have a page called Quick Facts Quiz. And we are going to literally, I'm going to put test questions from this book. I'm just ask you questions. I'm going to ask you questions from the book, and I just want you to write down the answer next to the number. Don't worry about writing down the question, just write down the answer. And this is an individual exam, so you don't need to put comments on the screen. Don't type in your answer. I want everybody to take this individually, all right? So you guys understand, I don't want you to write your answer. You have your workbook for a reason. See if you know this book, because understanding the topics in this book, the 5-star quick facts, are going to be tremendously helpful to you. And if you're in nursing school, you need this book. If you're studying for NCLEX, you need this book. So let's go over it. Let's go over it. Okay, so question number 1, we're going to do 5-star quick facts review. Write the answers on your paper. Write the answers on your paper, not in your phone, not on your computer screen, but on your paper. And it's going to be all good. All right, we're going to start with question number 1. Question number 1 is simply this: shingles or herpes zoster is caused by Which virus? What virus causes shingles or herpes zoster? This is 5-star quick facts. This is 5-star quick facts quiz. You either know it or you don't know it. It's okay if you don't know it. Just know you got to study this book more. All right, let's do the next question here. It is this. Okay, tardive dyskinesia is a side effect of which class of medication? Tardive dyskinesia is a side effect of which class of medication? You guys are like, do you know it? Do you know it? This is content right here. And I love this about quick facts because it shows your weaknesses. Next question is this. Read it right here. What organism is the cause of tuberculosis? What organism is the cause of tuberculosis? Just write it down, not on the screen, on your paper, Here we go. Question number 4, I like this one. How often do you change a bag of TPN, total parenteral nutrition? How often do we change that bag? Okay. I am moving on. This is either know it or you don't know it. All facts, quick facts, we like to call it around this part. And question number 5 says, iron supplements should be taken with which vitamin to promote absorption? Iron supplements should be taken with which vitamin to promote absorption? All right. Remar nurses, this is the time, this is day 7 of 7 days of NCLEX. You've been doing so good. Here's the next question. What is the cause of ulcerative colitis? What is the cause of it? What is it? Do you know what it is? Did you study it in this book? This is quick facts, and this is what I love, is that topics that you don't normally hear about, it's presented to you. So what's the cause of ulcerative colitis? Number 7, what 2 organs are most affected? What 2 organs are most affected with Wilson's disease? Wilson's disease was a new topic that I added from the original 5-star, from the original quick facts and into the 5-star. So what 2 organs are affected? We only have a few organs. Just take a guess if you're not sure. If you don't know what Wilson's disease is, look that up. Very important to know for NCLEX. Question number 8 is this. Which age group gets von Gerk's disease? And Remar nurses that are taking this, help your classmates out through prayer, not by writing it down. Von Gerk's disease, which age group gets this condition? Quick facts for NCLEX. We are studying, we are digging deep. This is what we do when we come together. Question number 9. Why must TPN be gradually decreased? Why must TPN be gradually decreased? What saith you guys? We're going up to, well, I don't know, I guess we'll go up to what, 15, 16, 20? Let's go. Let's just keep going. We are studying our content. Why must TPN be gradually decreased? What is the safety concern with that? Question number 10. Can skin be sterilized? Can you sterilize skin? Have you heard of sterilizing the bowels? Have you heard of that? Can skin also be sterilized? What do you guys think? Most of the cavities in our body, I don't know if you guys realize this, most of the cavities in our body are sterile. They are bacteria-free. The bladder, the uterus, they are free from bacteria. What about the skin? Can it be sterilized? Question number 11. Sickle cell anemia causes sickled blood to do what? What is the issue with sickle cell anemia? What do you think? Question number 11. Write it down. It's a new year, it's a new day, but we are studying the same nursing content because it really doesn't change. It really doesn't. Question number 12. A negative pressure room should have how many air exchanges per hour? A negative pressure room should have how many air exchanges per hour? Isolation right here. All subjects will be presented from the 5-star quick facts. What do you guys think? Talking about isolation, how many fresh air exchanges per hour are required? Question number 13 is this. When taking tuberculosis antibiotics, which vitamin will be depleted? Which vitamin will our patients have less of if they're taking tuberculosis antibiotics? What do you guys think? Write it down. Write it down. Question number 14. Here we go. What are the isolation precautions for herpes zoster? What are they? What are the isolation precautions for herpes zoster? Question 15. You guys are doing so good. We're almost at the end of it. What are the indications for the tracheostomy? We talked about it earlier. So why would a patient, what are the indications for the tracheostomy? What do you guys think? Question number 16. Med-surg. What vitamin is important in clotting blood? What vitamin is important in clotting blood? Welcome if this is your first time with REMAR. This is what we do. We're bringing in the new year 2020, studying for NCLEX as only we are. You can search all over. There will not be another company right now prepping you to study for NCLEX on New Year's Day. This is how we get down around here. Question number 17. What class of medication can you give to decrease tardive dyskinesia? What class of medication can you give to decrease tardive dyskinesia? Some pharmacology for you guys. Yes. Here we go. Tardive dyskinesia. Do you know what it is? Do you know what it is? What medications can we give to suppress it, to stop it? Good question. Question number 18. How will the liver appear in von Gerk's disease? Remember I mentioned it before. How will the liver appear in von Gerk's disease? Yeah. Question number 19 is coming at you. Are you ready for it? Here it is. How long do red blood cells live in clients with sickle cell anemia? Okay. Think about a normal red blood cell life. And then how long will sickle cell red blood cells live? How long? All right. Question number 20 and our final question. What should a nurse always do before suctioning a client with a tracheostomy? What should a nurse always do before suctioning a client with a tracheostomy? What do you guys think? Write your answers down. We're going over the answers. This is how I want you to study for quick facts. I want you to literally get somebody, get me, get someone, and have them ask you questions from the book because you either know it or you don't. Let's go back to question number 1. It was this question right here. Varicella is actually the virus that causes shingles or herpes zoster. Did you get it right? I sure hope you did. Basic content right here. Number 2, tardive dyskinesia is a side effect of which class of medications? Well, these are our antipsychotic medications. More specifically, our typical antipsychotic medications. And you can read about that in Quick Facts, the pharmacology section. All right. Question number 3 is what organism, yes, what organism causes TB? The Mycobacterium tuberculosis is what it's called. And you guys should definitely know all about TB for NCLEX. Hey, how often do we change the bag of a client receiving total parental nutrition? It is every 24 hours. And the reason why we do that is because of what? It's because TPN is mostly dextrose, which is sugar. And bacteria love to grow, love to eat sugar. And so we have to make sure that we're changing our patients' feeding bag frequently, okay? All right, next question. You should take iron and vitamin C together because they will promote absorption of each other, right? So the iron is going to be increased in terms of absorption by vitamin C. That was question number 5. Question number 6. Oh yes, the cause of ulcerative colitis is totally unknown. There is no specific cause of why clients get it. But do you know what it is? That's very important. Question number 7, here's the answer. When you talk about Wilson's disease, it's going to affect the liver and the brain. The liver and the brain. Everybody's like, yes, I got that right. I remember it from Quick Facts. Question number 8, von Gerk's disease, a new topic in the 5-star Quick Facts. It's going to affect mostly children. All right. Why don't we abruptly stop TPN? Why don't we abruptly stop TPN? Because we're trying to avoid rebound hypoglycemia. Remember, TPN will naturally raise your client's blood glucose levels, and they get used to their blood glucose levels being at a certain level when they're on TPN. If you automatically cut out the nutrition, the dextrose all at once, your patient's blood sugar is going to drop. And we know after studying from Black Friday that hypoglycemia is a very serious condition. Patients can go into coma, and we don't want that at all. Question number 10, can skin be sterilized? Our skin can do many things, but it cannot be sterilized. It can only be considered clean. Question number 11 is this. Sickle-celled red blood cells have a tendency to clump together. They love to come together and cause painful clots in our patients. That's one of the reasons why sickle cell anemia is so painful, because when those blood cells clump together and they try to push through vessels, it's very painful. I want question number 12, and the answer is, how many fresh air exchanges should a negative pressure room have? Definitely 6 per hour. They must have at least 6 per hour. 13, when a patient is taking tuberculosis antibiotics, vitamin B6 will be depleted. Vitamin B6 will be depleted. Did you remember that from the book? Question 14, hey, what is the isolation precaution for herpes zoster? That is going to be respiratory. Make sure you have your isolation precautions all sewed up before taking the exam. Question 15, what are the reasons for a tracheostomy? Well, we talked about it earlier. Patients who have upper airway obstructions, like laryngeal edema, epiglottitis is another one that's in your Quick Facts book that you want to know. These will cause an airway obstruction that a tracheostomy will be able to fix for our patient. So upper airway obstructions. Question number 16 is this. What vitamin is important in clotting blood? It is vitamin K, and we are very proactive when we know patients have bleeding issues or are for surgery. Make sure that they have appropriate levels of vitamin K. Yes. All right. Question number 17, what medicine can you give to decrease tardive dyskinesia? It is anti-Parkinson's disease medication. Because remember, what is Parkinson's disease? You have these uncontrolled movements. So these medications will also help the uncontrolled movements of tardive dyskinesia. Very good. Question number 18, I like it. How will the liver appear with von Gerk's disease? It'll be a fatty liver. It'll be a fatty liver that you're going to see. Question number 19, just two more. How long do sickled red blood cells live? They live 6 to 20 days.
Say that again.
What?
You said how long do sickle cells live?
Oh. Question number 19, the answer is this. How long do sickled red blood cells live? They live 6 to 20 days. Yes, a very short life cycle, okay? And the final answer is, what should a nurse do before suctioning a client with a tracheostomy? That is going to be hyperoxygenate the client with 100% oxygen before sucking some of the air out as you try to retrieve mucus. And that's what happens when you suction a client with a tracheostomy. The idea is that you're removing mucus, but also you have to think this is also your patient's airway. So you're also removing oxygen from that patient at the same time. So you want to make sure your patient has enough, a reservoir of oxygen. They're hyperoxygenated. So when you remove some, it doesn't decompensate the patient. So how did you do for your quick facts quiz? Did you get at least 14 correct? That's what I wanted from you guys. 14 out of the 20 right. If you didn't, it's okay, because you just now know you need to study more. But if you did, keep up the good work. That is amazing. We are talking about the virtual trainer here, 7 days of NCLEX. We're at our final day, and I just want to show you guys how amazing it is and how you can study with it on the go.
Remar nurses, what's up? We are back with another piece of spiritual development. My name is Mark Callie, and I'm the president of Remar Review. You can consider me your Remar nurse chaplain. You know the model, guys. With God, it's possible. So what I want to do today is encourage you to test once again. There's a story in the book of Luke, beginning in chapter 17. The Bible says, "And it came to pass, as he, Jesus, went to Jerusalem, that he passed through the midst of Samaria and Galilee. And as he entered into a certain village, there met him 10 men who were lepers, which stood afar off. And they lifted up their voices and said, Jesus, Master, have mercy on us. And when they saw him, he said unto them, Go and show yourselves unto the priests. And it came to pass that as they went, they were cleansed. And one of them, when he saw that he was healed, he turned back and with a loud voice glorified God. And he fell down on at his feet and giving him thanks. And he was a Samaritan, the Bible says. And Jesus answering him says, Were there not 10 cleansed? Didn't I heal 10 lepers? But where are the 9? They are not found that have returned to give glory to God, save this stranger. And he said unto him, Arise, go thy way, thy faith has made thee whole. Arise, go thy way, thy faith has made thee whole. As nurses in the medical profession, you're dealing with individuals. Some people will come to you who are like lepers, outcasts, if you will. They might have deformities on their body, or their skin might have diseases in that you see boils or blisters or welts or rashes, and it just might not look appealing, so that these individuals are outcasts. And when you're dealing with them and when you are helping them through the healing process, remember it's important that you would have mercy and compassion on these individuals. You see, leprosy was the disease of diseases in that time. It was the one that you had to become an outcast of society and that you could not live amongst the citizens. In fact, if you were a leper, you had to declare yourself verbally out loud, unclean, unclean, unclean. And before you were considered a leper, you would go to the priest and they would do an examination upon your skin. They would look at your skin, and if it had a certain type of blister or certain coloration or certain conditions or pigmentation, you were declared to be a leper. And so what Jesus did, he had mercy and compassion on these men. And he says, go and show yourself to the priests. Now, this is the part that I want to share with you. When they went and showed themselves to the priest, in essence, these were repeat testers. You see, the first time they tested, they went to the temple and they were declared unclean. They failed the test. The priest looked at them, they examined them, they looked at the discolorations, and they looked them up and down and says, no, you do not meet the standards. You have failed the test. And so they had to go outside of the city and declare themselves uncleaned, or in this case, unlicensed. And so when it came to Jesus, he had compassion and he had mercy on them. In fact, Jesus' mercy was the reason that he told them to go back and test again, or go back and show yourselves to the priest. If you've ever been in a point of failure in your life and you meet Christ and he has mercy on you, he's going to tell you to go back and show yourself to test again. But this time when you go back, you're going back with a testimony. You're not going back the same way as you were. You're going back healed. And so what I love about this is that God had mercy and compassion, told them to go and test again, that they would be declared clean. And so if you've been at a point of failure, go back and test. But listen, after you test, realize it's not just about passing the test. It's not just about getting your license. It's about more than that. The one that came back was a Samaritan, and he said that he came back and he worshiped Christ, and he said that glory to God with a loud voice. And Christ says, were there not 9 others? Were there not 9 others that were meeting that standard, that were able to pass the test? But you've come back. And he says, arise, thy faith has made you whole. The goal of passing NCLEX is not only just to get your license. The goal of passing NCLEX is to be whole, to be a blessing to those around you, to glorify God in the process. So as you continue on your journey, I want to encourage you today to go back, test again. But once you pass, come back with a testimony. Come back and declare that you are healed and that you are whole. Remember this, you have to go back to the place of failure. Passing the test may be the goal, but wholeness is God's plan. You can, you will, and you must pass NCLEX.
All right, Remar nurses, this is your season. This is the perfect time. Be nice to yourself during the holiday season. Give yourself the gift of passing NCLEX. This is 7 days of NCLEX, the perfect opportunity for you to do what needs to be done in order to pass NCLEX. I love seeing you guys. I love studying with you guys. You can, you will, and you must pass NCLEX.
Yes, I'm just like you, trying to pass this NCLEX. And it has been something else. I am a repeat test taker. I made 2 attempts to take the NCLEX RN exam. My mother got sick the first time. I could not reschedule my test because I was at the very end of the time that was allotted for me to reschedule. The second time, I did not realize that I had test anxiety, so I failed again. And I'm not going to give up. So I purchased the Remar, Miss Regina's Remar self-study DVD program. And I want to be honest with you, you have to have some discipline in regards to that. I will pick it up, put it down, pick it up, and put it down. But I didn't give up. Secondly, when I found out about the virtual trainer, I just decided, I was skeptical at first, but I just said, you know what can I lose? Let me listen to Monday Motivation. That's how I found out more about it. And I listened, and I am so glad I listened for that whole hour. And I want to tell you, this has been a blessing and a true blessing. And every good and perfect gift comes from the Lord. I want to tell you, please, if you can get this program, the virtual trainer, It's just like having Miss Regina right there with you. You're in her classroom. Like me, I'm easily to get distracted when I'm trying to study. So I cannot handle like a lot of chattering and talking and things like that. So it's just like me being in my classroom. There are students around and I'm aware of that, but it's just like the teacher and I having our one-on-one. I did try going into the program, and the only issue that I ran into, and I'm quite sure that's something very small, it could be just the internet, where the radio button gets stuck when I'm trying to finagle through the questions or what have you. And this is just like the little app before you know, the little program you do before you get your book. That's it. When I tell you this is so awesome, please, 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 I know with this program right here, along with what we already have as far as REMAR, you will and we will pass this test. I honestly tell you, I am not a person to get on Facebook, to do a lot of talking, make videos and things like that. But because this is one of the requirements, I want to speak to you to say, please, please, please get it. I'm a firm believer. I don't like wasting money, but you will not be wasting your money. I honestly tell you, this is a godsend. Her and her husband and that team is a godsend. I never went out looking for them. One day, Miss Regina dropped in my inbox. I don't know how she got there, but from a spiritual realm, I believe it was God because I prayed. Now, having said all of that, is that you will pass NCLEX. Sacrifice. It's Christmas time. Ask your family for as a gift. So guess what? Once we pass the NCLEX, guess what? We'll be able to pay back because we will have the money. Our income will grow and you will have a good job after that. So if I can honestly encourage you, please get this program. You will not be sorry because, and I don't mind telling anyone, I am a kinesthetic learner, so I have to have hands-on. I have to see it, say it, do it. And this program that Miss Regina and her husband and team has put out, this virtual trainer, I can tell you it's A+. It deserves to go into New York Times all best. So I want to say God bless you. I wish you well, and we can. We must pass the NCLEX. God bless you.
Hello, good evening, my fellow REMAR nurses. I'm here to give feedback about the DVD package and the virtual trainer that just got recently launched by Regina this past Black Friday. So let me just tell you a little bit about myself. I graduated in 2007 back in the Philippines, so that's where I got my BSN, and it took me a while to figure out that I want to pursue my nursing career, so here I am. Anyways, fast forward. I took the board exam last year with UWorld, just doing questionnaires, and my results were close to passing, and I was devastated. I didn't know what to use as a study guide since I've been out of school for so long. So I've tried Kaplan because all my friends that I know and they used it, and it worked perfectly for them, but it didn't for me. So that was my second review, and I wasn't confident enough to take the NCLEX, and so I was doing research and found Regina, thanks to YouTube, and got the DVD package. I'm very happy with it. I love everything about it. Quick facts, I mean, it's hands down, I cannot say anything bad about it because everything is literally here. I have also the practice exams and the activity book, but I think looking at what I have right now before I purchased the VT, it's something that I can't take with me all the time, especially I do work full-time, so I do study. I like to study in my breaks sometimes. I try to do it at the end of the day because that's when I have time to do it, but with the VT, it's literally
easy access, and you can start studying right away. I like that everything is compressed there, and they expanded a lot of stuff. So I think with this I'm very happy with, but because I didn't want to miss anything, because I believe that, you know, Regina said that it's updated and there's more stuff in it, I want to give my 110% this time when I take the NCLEX. So hopefully in God's will I will pass it next time. I will, with Remar on my side. I love the VT. I mean, everything. I'm so excited to get into it and to the questionnaires and get more updated stuff. But I'm still keeping this because I love them. I just love them. But I just like that this is on the go. So I think it's an investment. As Regina said, I don't think I will lose either way. But with a VT, it's always good to add more information, because, you know, I don't want to stop learning from here, and I know that, you know, I could pick up more stuff that probably is not here, like practice exams and all that, on the virtual trainer. So I went ahead and purchased it. I have no regrets regardless.
All right, Remar nurses, this is your season. This is the perfect time. Be nice to yourself during the holiday season. Give yourself the gift of passing NCLEX. This is 7 days of NCLEX, the perfect opportunity for you to do what needs to be done in order to pass NCLEX. I love seeing you guys. I love studying with you guys. You can, you will, and you must pass NCLEX.